it was about the dogs. Nah, it's about power. Yeah. Put up to the specialty, sunrise on the ground. Dogs in the grooming tents, whispers all around. Catalog smiles with the tension in the air. Every handshake got a hidden little snare. Bored in the back room, running quiet little schemes. Bylaws in the pocket like a stack of poker dreams. Players for the breed, but they got in their throne. If you question anything, they coming for your bone. Grievance in the envelope, certified mail. Club just a system, but the deck.
Good morning, everybody. Welcome back. If you're new here, welcome. If you're returning, welcome back. So it is day 10 of the Lindsay Clancy Trial. Should be quite spicy this morning. I believe we have, don't know if prosecutors ended on Friday or if we have cross-examination, but it should be quite spicy today with defense, because I'm pretty sure this is the doctor that they're blaming most of Lindsay's issues on, because she's the one that prescribed the Zoloft to Lindsay. And that's been his issue the whole time, is that you don't give Zoloft to a mother with postpartum. So, sure, he will get into that. That's his big issue the whole trial so far. So this is Dr. Tuff will be back on the stand, and I'm pretty sure that's what he's going to dive into, is giving the Zoloft. So should be quite spicy, I would imagine, since he's been quite spicy with the rest, badgering the witnesses pretty much so far. But I'm not sure if trying to remember if they had no more questions, or if they're going to question her a little bit before he gets into his. Anyway, a bit interesting. Should be for at least an interesting day today. So everyone is showing in the courtroom, except for them and the other stream that we watch. So here for right now. Hope everybody had a good weekend. All it did was rain here. Rain, rain, rain. There's so many conspiracy theories going around right now on this trial. A lot of people believe that Patrick is the one who did it and is blaming it on her. What do you all think of that? You think Patrick did it and is blaming on her? There's a couple theories. Trying to. Oh, the Courtney Clenny plea hearing is this morning also. She's the OnlyFans model who killed her boyfriend with a paring knife and then filmed it and went live afterwards. She was supposed to go to trial, and then she took a plea deal right before trial. I wanted to cover that, but that's going on the same time this is. I'm curious to see what her plea is, to see if the family would actually accept that plea. I'm guessing instead of murder, they're going to do manslaughter, which would be a shame because she stabbed him in the heart with a paring knife. So a little paring knife. Supposedly she threw it at him and it just landed in. She went in, her interrogation was wild. You can find that on YouTube. She was literally covered in blood. But there's a lot of, the apartment that they lived in had a lot of cameras and stuff like that, even in their elevator and stuff like that. She literal spousal or domestic violence because they weren't married. It was her boyfriend. She should get the death penalty, in my opinion. But I'm trying to think of where she's at. But she killed him. It's sad. Man loses his life over. But there's a lot of, from what they say, and of course I don't know the information because it's not going to go to trial. She's taken a plea. If the judge accepts it, the judge has to accept it. Family has to accept it, and the judge will accept it based off of what the family wants and all that stuff. It's sad. The man lost his life over nothing. It's unfortunate. But she was covered in blood. And her family also. They either got, if I'm not mistaken, don't quote me on this, I'll have to look up the information again, because of course this was a couple years ago also. They got charged for obstruction because they tried to hide a bunch of information.
Good morning, Your Honor. May I proceed?
Yes, please.
Your Honor, before the court today, we have the matter of Commonwealth versus Lindsay Clancy. Ms. Clancy is present. She is represented by Attorney Kevin Reddington. The Commonwealth is represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
All right, well, good morning, everyone. Good morning, counsel. Good morning. Hi. Morning, Ms. Clancy. All right, before we begin and return to this witness, can I see counsel sidebar just briefly?
Some of the comments and other streams are crazy.
All right. Jurors enter. Hey, all this have anything to do for the Honorable William Sullivan, Justice, Superior Court, now sitting in Plymouth, fifth for the Commonwealth. For all the ADB attendants, who shall be heard. God save the Commonwealth of Massachusetts, this court is now in session. Please be seated.
Good morning, Your Honor.
Yes, please.
Your Honor,
Yes,
before the
please.
court today, we have the continuation of the jury trial in the matter of Commonwealth versus Lindsay Clancy. Ms. Clancy is present. She is represented by Attorney Kevin Reddington. The Commonwealth is represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
Thank you, Madam Clerk. Good morning, everyone. I hope everybody had a nice, cool weekend as best you could. We were able to kind of recharge the batteries a little bit. So what I'm going to do is I'm going to ask you those questions, make sure everybody was able to follow my instructions, and then talk a little bit about today's schedule, and then we'll get right back into the case. So first, let me ask the questions. Has any member of the jury read, seen, heard, or overheard any source about any aspect of this case that would affect your ability to be a fair and impartial juror?
Wow.
Next, is there any other serious matter of concern bearing on your service as a juror in this case that anybody needs to bring to my attention? Thank you for following those instructions. And then in regards to today's schedule, we've got a number of witnesses. I'm not quite sure how long it may go. So we may break a little bit early today, just kind of depending on the way the case comes in. And in regards to where we are right now, we're going to, remember, when we broke on Friday, there was a witness at Dr. Tufts. The Commonwealth had finished their direct examination. We're now going to have that witness return to the stand, and the cross-examination by the defendant will begin. All right, and so with that, if we could recall that witness. Good morning, Doc. All right. Ms. Reddington?
Good morning, Doctor.
Morning.
Do you have your record?
Wow, he has got a lot of stuff.
You can look at that anytime you want.
Thank you.
Dr. Tufts, you are
Hopefully he finds a mic today.
a psychiatrist, correct?
Correct.
Tell me where you went to med school,
University of Vermont,
and what were the years you were at university?
2014 to 2018. It is. It's beautiful.
And when you graduated from this, you did your residency,
Correct.
and where was the residency?
Boston Medical Center.
And can you tell me, what is it exactly that you do as a psychiatric resident or psychiatrist resident? What do you do?
You do a lot of different things. You rotate in all the different aspects of psychiatry, as well as internal medicine, so that you have a foundational knowledge of broad medical topics. You admit patients into the inpatient hospital. You manage emergencies in the hospital and in the emergency room, decide whether patients need to be admitted psychiatrically or not, and also carry a panel of outpatients.
And is this a hospital that you're working
So yes, it's the Boston University program located at the hospital, Boston Medical Center, with also a lot of time spent at the various Boston VA locations.
And what were the years of serving residents?
2018 to 2022.
So basically, we're working as either person studying to be either graduating and becoming a resident through the entire field.
For the first part of the pandemic, yes.
The pandemic in July said it ended by 2020.
I'm not sure exactly when he said that.
Would you agree with me that when the pandemic started, around 2019, and the residency it was a large portion, if you will, of the pandemic time frame.
Yes.
We all had to walk around with masks and had no contact with people, and sure you have 6-foot radius before you touch anybody, all of that, right?
Yes.
How did that impact your residents?
Well, I still went into the hospital most of the time, wearing the proper protective equipment, but I absolutely still provided the necessary medical care that was needed. And some of the outpatient experiences were done via telemedicine. Yes,
That's like a television.
it's Zoom or something similar.
Touch people, take kids, anything like that while you were working in residence?
Sometimes, not, I think everybody had to keep their distance at certain times. I began my program before the pandemic, so of course there was a lot more handshaking and things like that then.
You can't really keep your distance though, with working as a labor and delivery nurse with a woman who's having a baby directly in front of him.
I imagine not.
So, when you finished, you graduate from residency, or is it like you get a certificate or something?
Yes, there is a certificate for completing it.
And then, at that point, you are now a licensed doctor.
Well, you're actually a licensed doctor the entire time that you're in residency. But upon the completion of that, you can obtain a full, unrestricted Massachusetts license and also become board certified.
And board certification, for example, board certification in child psychiatry, is that correct?
Yes, sir.
And when was it that you got that certification?
When was it? It was September 12th, 2022.
When was it that you actually started working as a physician, as a psychiatrist?
I started working as a physician and as a psychiatrist during the residency training program, but I started practicing completely independently at Astor Mental Health in August of 2022. Yes.
Now, prior to working with or at Astor, is that ASTOR or
ASTER, like the flower.
what is that? Is it like doctors?
It is a outpatient practice that is owned by a psychiatrist. It has a number of psychiatrists as well as therapists.
And it was located in the brick and mortar type place where we have offices.
Yes, the original offices were in Braintree, Massachusetts, and now there's an office in Peabody as well. So at the time I saw the patient, I was working in the Braintree office. I currently work in Peabody. Currently in Peabody, Massachusetts.
So when you start working at Aspen, you see like anything else, you submit a resume, application, passes in the time.
It's a fairly lengthy process and a number of interviews with different staff at the practice, and some recommendations, letters of reference, verification of credentials, all of that. But yes, it can be comparable to another profession in the process.
Now, in August of 22, congratulations on this, is what I would like to ask. How many women had you treated in the residency that were postpartum?
With postpartum depression? Or just in the postpartum period?
How many women that were in the postpartum period did you treat prior to August 22?
Many. It's hard to give an exact number, but I did have specific training in that population.
In that population? And where did you have the training in that population?
At Boston Medical Center.
And can you tell us in that 2-year period, approximately, how many that were in the postpartum period that you treated?
Okay, so it's really hard to give an exact number, but if I had to say, at least 50.
So in the 2-year period, you treated 50 people in the residency that had postpartum. Can you tell me when this postpartum was that?
Well, I just want to address that it was a 4-year period, not a 2-year period.
Oh, sorry. Okay.
And sorry, what was your question?
Hold on. You saw 50 people in a 4-year period that had postpartum. After that period, right?
Possibly, yeah, more or less. I saw a number of other patients. I saw much more than 50, but yes.
So after you had your residency, after you were hired by Aspen, is that when you began in August of 22 your practice as a practicing psychiatrist?
Yes.
And when was it that you actually got your DEA license that authorizes you to prescribe medication to citizens?
So during residency, I had a DEA license, but it was affiliated with the with Boston Medical Center. And then when I started at Astor, I had my own DEA number. I don't know exactly when, maybe sometime around August.
So August of 22, you started working at Astor. August of 22, you got your DEA license individually that authorized you to prescribe medication, correct?
Yes.
And it was when that you saw Lindsay Clancy?
I believe our first visit was September 15th,
Of
2022.
So you were practicing as a psychiatrist for a little more than a month.
I was practicing independently with my full credentials for about a month, but the training is just immense that goes on before that.
Absolutely. That's a residency, right?
Yes.
And you know what a residency, all I know is Grey's Anatomy, but I mean, working under a doctor, the doctor's a supervisor, and they tell you what to do, report to them, correct?
They don't really tell you what to do. They're there as a
They're
resource
supervisor.
if you need additional support. But I followed many of my own patients. I was the only person in the room with them. And, my notes were signed off by an attending physician, and that attending was available for any support I needed.
So in August of 22, when you started working at Astor, you actually filled out a form for your advertising. Is that correct?
I believe that was handled by other people at the practice.
And who was that?
Well, we have non-clinical staff that handle the administrative matters.
Okay, but you're a doctor and you're out there to the public, you're advertising yourself and your services.
She's trying to make her sound incompetent.
I believe, yes, I am not directing the marketing of our office, but yes.
Okay, never mind your office, I'm talking about you. You had an ad that was in on the computer that if somebody wanted to reach out to a doctor, they could see your ad amongst many others, right?
Well, I don't think there was an ad. I think we have a website that had some information about myself.
Now, in August of 22, up until when you saw Lindsay, how many patients in that month or so had you treated for postpartum psychosis?
How many patients in a month? Up until that month?
I'm asking you about when you started working, August of 22, for Astor, and you are now on your own as an employee. How many patients had you treated before you saw Lindsay Clancy for postpartum psychosis?
Just this month.
Well, in the span of 1 month, I would say none because it's a very rare disorder.
But it exists, doesn't it?
Absolutely.
And one of the things would be the voices that people hear, right?
That is a symptom of psychosis. Absolutely.
And that's legitimate, isn't it?
It is a legitimate diagnosis. Absolutely.
The diagnosis, people that have postpartum psychosis hear voices, do they not?
Many do. The disorder can manifest differently in different people, but yes, many people do hear voices.
How about postpartum depression? How many people in that month or so before you met Lindsay did you treat for postpartum depression?
In the span of 1 month, it's really hard to pinpoint that. Maybe a couple.
Maybe a couple?
Maybe.
And you recall how one treated them for?
Again, it's hard to really pin down the individuals in a short span of time.
Can you tell the jury what you put in your ad or in the Astor website that you indicated that described you?
She didn't do it.
I don't recall.
One of the things you did is that you said that you basically were a specialist in postpartum. People.
And she specialized in it.
Psychiatry. You indicated that on the website.
But she didn't make it.
Are you able to read the actual document? I don't remember exactly the wording.
You've been working now for how many
Yeah.
years now? 3 since you saw Lindsay? Or more?
Almost 4, yes.
You haven't changed your ad on the website, have you?
She didn't make it.
I have not personally, no.
And you've read it probably a bunch of times, right?
I've read it a couple of times, but I don't spend a lot of time on my website.
Okay. Do you recall that you indicated that you were specializing in any particular aspect
So,
of psychiatry?
yes, it probably includes a special interest in women's health, in perinatal psychiatry, in trauma-related disorders, anxiety, and there may be some other things that were mentioned.
Yeah, like women that have babies and they're suffering from postpartum depression.
Absolutely.
You emphasize that after a month working for Astor, right?
That's listed as one of my interests, definitely.
And again, forgive me, how many women did you treat for postpartum depression in that month and a half before you met Lindsay?
Oh my God.
I don't know, maybe a couple. But I've treated many of them in the residency, which was just immediately before.
So when a person needs to see a psychiatrist, generally they're not well. Is that fair?
Some are not well. It really can vary.
So when someone comes to see a psychiatrist like you, it's because they need help, right?
I'd ask him how many
Yes.
as an undergrad, how many cases did you study?
Because they need help. For example, with Lindsay Clancy,
He probably couldn't remember.
she came to you because of your ad, right? Or your website for Astor. You said about this help.
I don't know exactly how she found us.
Well, do you know why she came to see you?
I'm not sure exactly.
Friday, you spent a long period of time going through your the initial intake that she had to fill out. Is that correct? You recall that?
Yes, we did.
The district attorney kept asking you, and this is in September, is it September 12th? Is that when that form was filled out?
I believe she completed the form on the 12th. The appointment was on the 15th.
So what does a person do? Do they call you or do they talk to somebody in administration? How do you get the form to fill out?
Yes, our administration handles that.
And what do they do? How does that happen?
They send them the documents, probably by email, and the patient fills them out. It might be all within the portal that we use,
Within the portal?
the patient portal, yes.
Okay, and that means that you went online and you can access Master Mental Health and all these little drop-down boxes would come up?
Something like that.
Are you aware? Is it something like that, or are you aware of what it does?
So because I don't handle the scheduling and the sending of forms, I don't know exactly what it looks like.
It's the form that you're giving a person that needs help because they're possibly mentally ill. Is that right?
Yes, and what's important is that I review the forms and we go through them in the appointment. Absolutely. Yes.
Now, understand that
He's such a
the
dick.
records, 729.
You do.
The jury will have access to the Tufts records, okay? You're aware of that, right? You know it's an exhibit,
Yes.
because you have talked to the prosecution about what an exhibit is, and you know that your records are now in evidence before the jury, right?
Okay.
If that's what you say, yes.
Take what I said.
Well, I don't really,
That's fine.
I don't know the details of how this works, but
Have you talked to them prior to your testimony?
no,
You haven't talked to the DA's office?
no, not at all.
You're a defendant in a very large lawsuit.
Okay. You're gonna bring in the civil trial now? Again?
Yes,
You would happen to be represented by an attorney.
I am.
And the fact that you have an attorney is your right. Doesn't mean you're guilty of anything, right?
Right.
And you know that the outcome of this case is very, very major to the outcome of your lawsuit.
Objection, relevance.
I don't actually know that.
So you understand that if in fact it's determined that you advertised as an expert in postpartum and in postpartum psychiatry, and you had a month experience plus a residency, would you consider that to be negligent or misrepresentation?
Objection.
I do not believe that I've been negligent.
Do you understand what misrepresentation means?
Yes,
With a month under your belt plus your residency, you really want this jury to believe you were an expert? Advertise that.
I don't think that's exactly the wording that I used. I think I said that it was an interest of mine.
Objection, badgering the witness. Let her answer. Holy
I
shit.
just think the wording was that it's an interest of mine. I don't believe I called myself an expert.
Are you an expert in postpartum?
I may be. I don't know. I think it depends on what you define an expert as.
Well, when a patient comes to you and they fill out the form, you agree with me that your records reflect that form that she filled out on September 12th of 2022, right?
Yes.
And the form that the district attorney went through painstakingly with you is basically something like this, right? That's one of the forms that you have people fill out, right?
Yes.
Right?
Yes.
See the little check mark?
Yes,
What's the check mark?
the patient.
So how many pages, because I don't want to go through all the pages. How many pages does a patient, or how many pages did Lindsay go through to check the boxes for acid?
There were a lot of pages.
It's a lot. Okay?
Yeah, maybe between 10 and 20.
And basically, they're all little
Hey,
checks
T.
in boxes, correct?
That's good.
Not just checks.
No? So does the person then answer questions by typing in the answers such as, do you have any pending legal problems? No. Have you ever been arrested? No. Things of that nature, right?
Those are some of the questions.
And the questions also, do they ask the patient what medications they were on
Yes,
before seeing you?
yes,
And
Aw,
Lindsay told you that she was on SSRIs in the past, right?
yes.
And SSRI means what?
A selective serotonin reuptake inhibitor.
And that's pretty powerful stuff.
It's an effective treatment for depression and anxiety.
Well, it affects the serotonin.
whoa,
Yes.
It rewires the brain.
It doesn't rewire the brain. It
Sorry about your
increases the
ears.
serotonin.
that
And
was not me, it was the
many
cord.
individuals with depression have low levels of serotonin.
So Lindsay told you that she had been prescribed an SSRI. She was in nursing school, right?
Yes,
What was the SSRI?
Prozac.
And how long was she on?
Right, sorry, that was
I'm
the
not sure.
court, sorry.
I probably asked.
Yes. Isn't it true? Don't you guys have a saying that if it's not written, it didn't happen? You take copious notes, do you not?
It's impossible
That's what I
to
would've
write
done.
down
job.
every single thing that's said. So I write down what is clinically relevant, clinically necessary. But there's a lot that is discussed over an hour that is not able to be written down.
Such as the fact that a person was on an SSRI when they were in nursing school is not an important fact to find out.
Oh, no, that's important. Sorry.
No problem. I'm not doing, the Sophie Cunningham act. I'm just asking a question.
What?
That's all. And you can answer it, okay? How about if she had a reaction to Prozac?
I asked her about the Prozac.
Is that written in your notes?
Yes.
And what did she say?
I mean, she said that she took it for
Nice.
a period of time. She didn't mention any side effects.
She didn't tell you that she had side effects. So when a patient comes to see you with a month under your belt and they're sick and they're looking for help,
Oh,
you wait for them to volunteer facts to you?
yes, that's kind of how you
She
do it.
volunteered a lot of information. She knew very well what her medical history was and was able to provide
Okay.
that for me.
Such as what? That she was in nursing school and took Prozac?
That's part of it.
And she told you that, right?
Yes,
And she was pretty upfront and honest with you, wasn't she, in answering these questions, right?
I believe that she was.
We all spent some time talking about the fact that she declared that she had consumed alcohol and she felt guilty about it.
Okay,
Called that on Friday. Dwelled on that for a while, didn't we?
Yeah, yes, that was a component. Yes,
I mean, that's something that's important, right?
yes.
What was her drink of choice?
I'm not sure.
Did you ever ask her?
I'm not sure. We were not concerned that her level of alcohol use was.
Certainly was Friday, right?
All right, here's.
yeah, argumentative.
Done. Wait for the question, all right? And then same thing, I'll have counsel wait till you finish your answer, all right? Go ahead, Mr. Reddington.
So is it important, doctor, for you as a physician to know your patient? In other words, know who they are.
Yes,
And you know that Lindsay was a nurse, right?
yes,
You know that she graduated obviously from college, right?
Okay,
yes.
She a good student.
how would you know?
I don't recall.
You know when she got married?
I don't recall a specific detail. I don't know. I knew she was married.
She had 3 kids, right?
Yes,
And the reason that you know that she was married is because you spoke to her husband Patrick, correct?
He Sorry?
What did you?
He attended one of the appointments and I spoke with him on that date.
Ah. And did you say, I know why, you give a handshake when you came to your office?
It was telemedicine.
It was what?
Telemedicine.
Telemedicine. Is it fair to say that after, 14, you said to the jury, 14 appointments that we've had with Lindsay during that period from September till January, 14 appointments?
Yes.
Every single one of them by telemedicine.
So,
Yes.
a lot of people do
So
that.
you came in this courtroom Friday, you never saw this woman in person, did you?
Correct.
Were you ever concerned about her mental health as a person?
Absolutely.
She was crying. She told you symptoms that she couldn't get out of bed. Isn't that right?
At one time she said it was difficult to get out of bed
Oh, difficult to get out. Why was it difficult for Lindsay Clancy to get out of bed?
because she was very depressed.
And did you give her a hug? Oh, no, you're on telemedicine, so you couldn't give her a hug, could you?
Why would she
You
give
didn't
a
have
hug?
any chance to even look at her in person, did you?
I could look at her. It was always a video appointment. I couldn't give her a hug, but that's not actually something that psychiatrists typically do with patients.
Yeah, they don't touch them. Weird.
Now, I'm looking at you, and you've got the witness here cutting you off in half.
This
right? So I can't see
volume thing is crazy.
waist down, legs, feet, your hands, anything. That's the same view that you have on the telemedicine, right?
Yes.
Isn't it fair to say that you've studied and that you've learned that there are objective manifestations that patients may have that would be a tell, like if you're playing poker, you have a tell, that would be an indicia of the fact that they're stressed or emotionally disturbed, right?
Yes.
Like hand wringing, right?
Yes.
Were you able to see the hands wringing?
I don't recall seeing her hands.
Recall, people sit there and they do this with their leg, like this, because they're going through some type of emotional stress. You couldn't even see her legs, could you?
I couldn't see her legs, but I knew that she was under stress.
So when she came to you,
This guy.
September 15th, I believe, is the first time that you all actually discussed her condition, correct?
Yes.
And looking at medical records, which the jury would be able to do that, it says visit date, September 15th, 2022, and you can look along with me if you wish.
What does he think people did during COVID?
Indicates, why she
when you weren't
came
allowed to
see
go?
you, right?
People just couldn't
Yes.
talk to their therapist?
Yes?
Yes.
Okay. Why did she come to see you? According, not guessing and speculating, I'm TV. Just look at your notes. Tell me what brought Lindsay Clancy to your office.
Postpartum anxiety.
Is that it? Is that what you noted in the records?
Well, those were her words when asked, what are the problems
Exactly.
for which you are seeking help?
Postpartum anxiety.
It's
Now,
still big
as a
today.
Psychiatrist, meeting with this young woman after a month or so of working as a psychiatrist for Astor, there are tests that you administer to a woman who's in postpartum to find out what type of anxiety they have, right?
Exactly.
Well, there are some screening tests, but the most important thing is what the patient tells you and what my assessment is in the session.
I see. And that would carry through the Tufts evaluations for all 14 of those meetings. It's what the patient tells you, right?
Yes, and what I observe in the session
Through television.
through the computer.
What
Regular health appointments
is
are by
Edinburgh
telehealth,
test?
not just therapy.
It is a scale that looks at symptoms of postpartum depression.
And when you administer, that's a major test, isn't it, for a doctor to evaluate a patient for PPD?
I wouldn't say it's a major test.
It's a pretty big one though, isn't it? It's the only one that measures the postpartum depression, right?
It's a common one.
So what?
Commonly used.
Oh, all right, so when you used it on Lindsay, when was that administered to her?
I did not use it on Lindsay.
Why?
We use the PHQ-9, which
What
is
is the PHQ-9?
it's a depression screening form.
That's like generalized anxiety disorder, general depression. It's got nothing to do with a woman suffering from postpartum depression, does it?
I disagree.
Well, do you agree that
He's not a
people perhaps
therapist.
that may know a little more than you determined that the Edinburgh scale is the appropriate scale to administer to a pregnant or postpartum woman?
Yeah.
You're familiar with the Edinburgh scale, right?
I've heard of it.
And can you explain to me how it's graded?
No, I cannot.
There are 30 questions in it, are there not?
I don't know.
I don't use this scale, so I don't know how many questions there are.
So the Edinburgh scale, do you even know that the cutoff for someone that is depressed in their condition of postpartum would be
Objection
15?
asked and answered. She
Anything
doesn't
over
know.
that, they're in severe depression.
Okay.
You know that her first Edinburgh test that was administered to her put her at a 23 overall. Severe depression.
I was not aware of this test. I was not aware that this had been administered to her.
Well, you know that except for the Prozac that she had when she was a nurse, what, 23 years old, she hadn't, other than seeing her own doctor for having a baby, she hadn't seen any doctors. You knew that, right?
I didn't know exactly which doctor she sees. I think we ask about your primary care doctor, but she did not report any other medical issues that she was under treatment for.
So is it important for Dr. Jennifer Tufts to know whether or not a patient who is coming to you for help has a prior medical history other than what they might tell you?
What?
Well, when patients are able to advocate for themselves and share their medical history, we rely on what they tell us.
Is she able to advocate for herself, in your opinion, when she
Seemed
came
to be.
see you? You evaluated her in September?
Absolutely.
How about October?
Yes.
How about November?
Yes.
How about December?
Yes.
And your medical records, you would agree, show that during that period of time, that she was deteriorating. It was a word that was used on Friday. Isn't that right?
It's the best one they have.
So
No, so you used the word deteriorating on Friday. You do not.
And I explained
she
why.
was a little bit worse at certain appointments. And the deteriorating word, which is not my word choice, is what is in the note because I had to select that.
That's why there's some kind of a program that you have to check the box.
Yep.
You have to bring down Dropbox. You can't take a pen and write something down about a patient.
There are certain parts of the note where I can write whatever I feel is necessary, but that specific aspect of the note is a button where you have to click one of three choices.
So when the jury's
She explained
going
that,
through
yes,
their
or
medical
Friday.
records, one of the things that they're going to see is that when you meet with a patient, you have a form that you fill out where it says, if you feel like you're going to harm yourself or somebody else, make sure you go to the emergency room, right?
Yes.
If you have any urges to harm yourself or others, go to the nearest emergency room. That's-
Every doctor tells you that, not just the psychiatrist.
Every single time that you meet with a patient, right?
Yes.
Every doctor
And
tells you that.
it indicates that if there's any, call the suicide prevention and crisis hotline. If you
I
feel
know.
that you're in crisis, you may text home to a particular number anytime. What's a suicide hotline?
What's a suicide
It's
hotline?
a phone number that patients in crisis can call and speak to a trained counselor.
Now, a psychiatrist, you agree with me, is not a counselor. That's the issue, right?
Well, a psychiatrist has training in therapy as well as in medicine.
Did you give Lindsay Clancy any therapy?
There was some therapy incorporated in our sessions, but we did. Sorry.
Oh my God, let her
provided
finish.
Emotional support, listening to her.
Hold on, I'll say it.
Right.
Hold on, everybody. Yeah, you asked the question,
Suspend.
we'll let her finish, and then you can follow up with any questions you want.
He's not going to let her finish.
Anything else you want to say?
Oh my
So
God,
her sessions
such a
were
dick.
largely focused on the medication management, but there was an aspect of therapy including those items.
Okay, sessions were for what, 17 minutes?
No,
How long was it?
Oh, did it have money in it?
25 to 30 minutes.
So 25 to 30 minutes on the television. And were you face the TV screen with her for the full 25 minutes?
Yes.
And that's not noted in your records. It says 17 minutes in all your records.
So if you look closely, it says the therapy component was for 17 minutes. It doesn't say the entire duration is 17 minutes.
It's usually a half hour. Like, he's such a dick. She explained this. This is just a repeat of Friday.
It depends on the person.
Well, how about Nancy? What did you do for therapy with her?
I listened to her. I listened to her concerns and provided
Came up with a
support.
plan?
I tried to provide her with hope that eventually things would improve.
And told her to get therapy.
You listened to her concerns.
Mhm.
And you agree with me that her concerns were, for example, that she actually was unable to sleep. It's one of her concerns, right?
She was having a lot of difficulty with sleep.
On the September 15th meeting, you indicate that her mood was okay, but her affect was anxious. You called it incongruent. Is that right?
So she said she was feeling okay. She appeared anxious, and she also stated that she was anxious.
So one of the things that you talked about Friday is when a patient presents with an incongruent something like that, appearance perhaps.
Something or another, I can't remember.
Saying, I'm okay. They don't look right.
Well, it could. I don't think her affect and her mood were really that incongruent at that time. I think that she didn't appear terribly depressed. I didn't say she was terribly depressed in that initial visit, but she said she was anxious and she appeared anxious. That's pretty congruent.
Okay. So did you put in the report that she was congruent or incongruent?
So that is not an option for me to indicate in that section, but it was congruent.
You're like a robot. You can't take a pen and write something down. You have to do the drop box and exits on the computer.
It's a form to fill out. Does he not understand how
Well,
this works?
If it's on the computer, I'm limited by the options that are there
You're a doctor. Why are you limited?
because of the technology.
What technology? The fact that there's a form on a computer? You're trying to treat a human being who comes to you for help.
And that's what's most important. What's most important was the treatment, not what is checked off on
Good job.
on the box.
Makes sense. So you were unable to make a note as to whether or not her affect and her mood appeared to be in conflict and that she would have been in conflict.
He wasn't in conflict though. She just said
and
that.
she
You,
had poor insight.
facts not in evidence. You're misstating, misrepresenting the facts.
Box doesn't matter.
Jesus. Oh my God.
Correct.
So basically, she's telling you that, okay, well, actually, when she came, do you know that she never saw, other than when she was in nursing school, would it surprise you, a psychiatrist? And that was only for like a week? When she got the Prozac in nursing school, because she was afraid of public speaking? Did you know that?
I was aware that she did not have a significant past psychiatric history. I was aware of that.
Okay, so you were the first psychiatrist that she had the pleasure of meeting, is that correct?
Yeah. I think it was.
And isn't that important for you as a doctor to take a history?
I did take a history.
So can you tell us? You're testifying here for the government. Tell us whether or not she had any past psychiatric history other than in nursing school for a week.
She did not report any other past psychiatric history other than the Prozac and Wellbutrin.
So when a patient comes to see you and you're treating to help that patient, if they don't report something to you, you don't know about it apparently, right?
Well, I think it depends. There are certainly things I can assess, but if it's related to their history, I do need them to tell me.
Well, you can't assess it unless you ask, right?
Unless I ask or they volunteer it or they
Of
fill
course,
it
we
out in
already talked
forms.
about the volunteering. How about you as a doctor, when you're evaluating a patient coming to you for help, do you ask them questions?
Yes,
You didn't ask for a prior history.
I did.
What did she tell you?
She said that her prior history was what we discussed about the Prozac in the nursing school.
So basically, other than hoping to give her hope, is what you said, for the therapy. How do you give someone hope for therapy? The other doctor.
Try to encourage them and
The 15th.
sorry,
What did you encourage her to give her hope on September 15th?
what did I encourage her?
Yeah.
I don't remember exactly the words. It was
Did you write
almost
it
4
down in
years
your
ago.
records?
No, we don't write those, details of
Well, that's
everything
the
that was
therapy
said.
you're talking about, right? Yes?
Yes.
And you don't write down the therapy you give a patient in the records, right?
Well, I write something about it.
You write it
I
down. No,
mentioned
not-
that.
Excuse me.
Hold on.
So yes or no?
Hold on. You let her finish the question. You listen to the question and answer just what they asked. Okay? Go ahead. You can rephrase that question, Counsel.
No, let her answer.
I mentioned that I provided supportive therapy.
What is supportive therapy?
It's listening to the patient's concerns and providing emotional support and validation.
So emotional support and validation all sounds good. Here's a young woman who is what, 20, 29, 30 years old, came to see you?
Yes,
And came to see you for help, right?
yes,
Told you she couldn't sleep and she was anxious, correct?
yes,
Told you she was postpartum, correct?
yes.
You know that as a patient who was postpartum. By the way, what is your opinion of the period of postpartum wherein one could have postpartum depression, or more importantly, postpartum psychosis? What's the time frame?
It's typically 1 year.
So she was well within that time frame, correct?
Yes,
And you tried to provide therapy by giving her hope. And how long do you figure did that take? 5 minutes, 10 minutes?
Oh my God.
I'm not sure. I think it was different in each session.
So the only thing that you diagnosed Lindsay with on September 15th was GAD, generalized anxiety disorder, correct?
It was generalized anxiety disorder as well as an adjustment disorder with depressed mood.
And you prescribed medications to her, right?
Yes,
And the medication you provided to her was the sertraline, right?
yes,
Sertraline would be Zoloft, right?
Yes.
This is a little chart that shows the prescriptions that Lindsay was on. And you have yellow colors.
Ah, his famous chart. He loves this chart.
Bear with me, but on September 15th, you prescribed sertraline, Zoloft, 30 count on September 15th, 25 milligrams, right?
Yes.
Have you ever read the website for sertraline?
The website for sertraline?
Sertraline, Zoloft is a chemical that is marketed as a pharmaceutical, right?
Yes.
Right?
Yes.
It's a pill, right?
Yes.
It's a pill.
It's an SSRI pill, correct?
Yes.
No, it's a
You know
tree.
that Zoloft is not indicated for generalized anxiety. Why'd you give it Zoloft?
It is a very effective medication for generalized anxiety disorder.
So you're familiar with the drug label with the Zoloft, is that right?
Generally.
Generally. Are you aware of what the manufacturer of Zoloft indicates it can be used for, to treat?
I'm aware that it's used to treat various forms of anxiety disorders as well as major depression.
So when Lindsay came to see you, you know that she had stopped breastfeeding her son, right?
Okay.
Not at the time of the first appointment.
When did she stop breastfeeding? In October.
Something around then.
You know that she had little or no psychiatric history other than seeing you, correct?
And the Prozac, yes.
You know that, in fact, that she had stopped drinking whatever it was that she was drinking.
Whatever it was.
Right?
I was not concerned about her level of drinking.
Well, it's in your form, right?
That was at the intake, but
You know that she wasn't drinking when you were meeting with her, correct?
yeah, that's what she told me.
Okay. You believe what she told you, right?
Yes.
Had no reason not to.
So when she sees you, she's not on any psychiatric anti-tropics or whatever they're called, medications, correct? She wasn't on any medication.
Correct.
And she had stopped drinking anything, whatever it may have been, right?
I'm not sure when she completely stopped drinking, but yes.
You don't know when she started, when she stopped, when she drank, do you?
Well, I was not concerned that she was an alcoholic.
Yes or no? Did you have any idea?
That's a yes or no.
Friday talking about her guilt and having that she drank alcohol. You don't know what she drank, when she started, when she stopped.
Have no idea.
I know some details about her alcohol use, but it was overall minimal. So
What were the details? Tell me what the details.
Drank 2 drinks.
What are the details?
that she drank 1 to 2 times a week, 1 to 2 servings,
5
5
times a day.
week.
Or 5 times a week, yeah.
What it was, you know what, right?
I think she had mentioned at some point that it was calming. It was something that was helpful, calming.
It was not, it was the way you're trying to know something, I guess, right?
That's one way of saying it.
She said calming.
I imagine you've treated veterans that have post-traumatic stress disorder, right?
Yes,
And would you agree with me that many times when people have an anxiety disorder or PTSD, or whatever the case may be, they try to numb their feelings? Is that fair?
sometimes they do.
Sometimes they use alcohol.
Sometimes they do.
You don't know what alcohol. She wouldn't even know if it was a beer.
I didn't think that was relevant for her.
So, with all of that, with that information, you then prescribed Zoloft to her, correct?
Okay.
Yes,
You went over the side effects of Zoloft, certainly, and I imagine with her, right?
yes.
Did you tell her that one of the known side effects of suicidal thoughts and actions is ideation?
Well, that's
Oh.
specifically in in children. So I don't think I mentioned that because it wasn't relevant.
Not really.
Not really. Okay, so now you're a doctor.
There's a black box warning, Zoloft, along with other SSRIs, right?
Under age,
No,
for children and adults younger than Lindsay.
Doctor, I apologize. Can you just listen to my question and answer it?
Wow.
Is there a black box warning?
She's
on
answering
Zoloft?
it.
Yes,
Okay. A black box warning is required or prescribed by what? The FDA?
probably.
Probably. And it basically warns that, especially with young people or young adults, that it may cause suicidal or, God forbid, homicidal ideation. Yes?
Yes,
And you're aware that, in fact, the FDA has determined that that goes up possibly to a 23, 24, 25-year-old. You know that, right?
I think 24 is
24.
what they
I'll
said.
give you 24. It's possible, isn't it, that the SSRIs that get into a person's brain affect a person that's 3 or 4 years older than the FDA cutoff with suicidal ideation or homicidal ideation?
Are you gonna let her
It's
finish?
possible.
There's a lot of development that happens in the brain between ages like up to 24 and closer to 30. The brain is fully matured at past age 24, and so it's less vulnerable than in a younger individual.
So with 24, you're suggesting is a cutoff. Are you suggesting to the jury that a drug that increases the risk of suicide in a 24-year-old patient cannot increase the risk of suicide in a 29 or a 30-year-old patient?
I don't believe there's evidence that it causes that at all in individuals over 24.
So, as a psychiatrist, had the ability to issue these types of medications.
All antidepressants have the warning. May
What
cause
research
it.
did you do on Zoloft?
Even if it's not black label.
I was taught extensively about SSRIs and suicidal ideation in my training. In Vermont, in Boston, yes.
Okay, so in Vermont was when you get your medical degree, right?
Yes,
And in Boston would be when you were a resident, right?
yes,
And then you had board certification on general psychiatry, right?
yes.
You can have a certification on the subspecialty, right?
There are certain subspecialties, yes.
Right. Some of the subspecialties deal with postpartum or women that are pregnant and have babies and have psychiatric symptomology.
There's no board certification for perinatal or reproductive psychiatry.
There are plenty of classes that are recognized. For example, at Harvard Medical School, there's an annual class or symposium, if you will, for postpartum. Do you have a name for that?
No, sir.
What have you done to research or to improve your education? I understand you went to med school, maybe you were a resident. What programs, continuing education, symposiums have you attended since you got the ability to prescribe these medicines?
Wow.
I have not attended a symposium.
Have you attended anything?
I have not, but I have done a lot of reading on my own of research and guidelines about this area in psychiatry.
Did you tell Lindsay when you were going? Because one of the things that you guys are always concerned about is what's called informed consent, right?
Yes,
What is informed consent?
it means
Internet consent, not just like on the streets.
Let her finish.
explaining to a patient the risks and benefits of treatment and possible alternatives, and making sure that the patient understands what you're saying.
Now, when you were going over the symptomology, and you were going over the side effects of Zoloft, one of the side effects of Zoloft is, and I quote, severe trouble sleeping, right?
Yes.
Did you tell her that?
Well, insomnia is listed as a side
No,
effect.
you already said yes, you know, and we just, did you tell her that Zoloft has a side effect of giving the patient severe trouble sleeping? That's all.
So I didn't use the word severe because it typically doesn't cause severe trouble sleeping, but I thought you were referring to when she told me that she did have severe trouble sleeping, and that was true.
Oh, right? She has severe trouble sleeping, right?
She told me, yes.
And you know that one of the side effects of Zoloft is, let's say, trouble sleeping. You know that, right?
Yes,
Your answer is yes, the jury has to be engaged.
yes.
Oh my God.
Why would you prescribe Zoloft to a young woman who's postpartum, who's coming to you with anxiety, who's telling you she can't sleep, she's got all of these symptoms, and you prescribe a medication that would have a side effect of trouble sleeping?
So individuals have very varied responses to medications. Some have no side effects, some have one or two. It's impossible to predict, but Zoloft is a top choice, a first-line medication for her. It was
Says who?
says it's the general consensus among psychiatrists.
Hold on, again, we can't have both of you talking at the same time. So let her finish her answer, and then I'll give you plenty of time to follow up.
He doesn't
any,
want her to.
Questions regarding her answer. So, you finish your answer on that?
There's extensive research supporting the use of sertraline in this instance, and the general consensus among psychiatrists is that it's a first-line safe medication for individuals, including postpartum women.
How about the kids that shoot other kids in high schools in the lawsuit?
What? Objection.
You read about them?
Overruled.
Sorry? I wasn't sure what the question was.
Question was, in response to your observation about how all the psychiatrists or the psychiatrists think that it's a very, very safe, wonderful first-line drug. We researched it. How about the kids that kill other kids in schools with the lawsuits that arise out of the use of SSRIs? Have you ever researched that?
No, we need to open up
I don't know
asylums
much
and put them
about
all
that.
in there.
You know about the SSRIs messing with someone's brain, they go out and shoot people for no reason, right?
I'm not aware that that's
This is
linked to
getting crazy.
SSRIs.
So you didn't really talk to her about increased risk.
This is gonna make me go on a rant.
4-year-olds are down because she's 4 or 5 years old. You didn't talk to her about the trouble sleeping that could be a side effect. But you described there's other drugs that you could
Ugh.
have given that would perfectly safe. Someone who knows psychiatric history to sleep there, right?
Not necessarily.
Okay, so you prescribed her with the Zoloft, it's 25 milligrams, right?
Yes.
Very low dose.
When you prescribed her with the Zoloft, 25 milligrams, was that increased up to 0.05 milligrams, or did you increase it?
Well, your sister.
The instructions were to increase it to 50 after 1 week.
After 1 week.
Yes.
And you expected that she would listen to your instructions, right?
Why wouldn't she?
And she did, right?
She waited about a month, but then yes, she did.
Why did she wait a month?
I don't know, because she don't
I think
listen.
it took her some time to decide whether that was truly what she wanted to do.
Right, she was pretty impressed, wasn't she?
She was afraid of side effects.
And she didn't want to take the pills, did she?
She eventually did want to take the pills because she wanted to feel better.
A month later, right?
Yes.
She didn't have to take them at all. Nobody forced her to.
The Zoloft, SSRI. And then tell her after a week to increase it. And she doesn't take that medication for a month.
Okay, then you can't blame that medication.
And then she did take the medication, right?
Yes.
And then, did you meet with her or talk to her before she actually decided to implement that particular regimen?
I had met with her beforehand, but I was not aware of when she made the decision to go ahead and take it.
So you met her on the 15th of September, right?
Yes.
When was the next time you met?
Can I check?
Absolutely. Look at the board.
September 28th?
And on September 28th, did you discuss with her the fact that she was afraid to take the Zoloft?
Yes.
And did you recommend that she do that?
Well, she said that she was feeling better at that point and wasn't
It's a
sure.
really easy question. When you talked with her, did you recommend that you increase or take the Zoloft?
At that visit, I don't think that I did.
Okay. So when did she actually take the Zoloft?
She told her October 20th visit that she had taken it 1 week prior.
And she told you that when she increased it in accordance with your instructions, she went off the rails, right?
I don't think she used those words, but she had
What words did
side
she
effects.
use to you as her doctor?
She felt awful.
Awful. Why did she feel awful? Did she have a stomach ache? Did she have a headache? Why did she feel awful?
She did have some stomach aches. She had some diarrhea and had a difficult time eating. She also had increased anxiety. She had some more depressed feelings. She had more difficulty sleeping.
And what was your advice to her as her doctor on the 28th of October, after she told you about the effect the Zoloft had on her?
I told her to stop it, stop the medication.
Okay. Now, Zoloft being an SSRI, and a patient that is taking the Zoloft from 0.05, we spent Friday afternoon going over the drugs, and 0.05 milligrams is the lowest dose and all that. That's the dose that is prescribed to people invariably, correct?
It goes up to 200, but that is a starting dose.
For pretty much all of you psychiatrists would agree with that, right? 0.05, right?
50.
50, okay. And you then told her to stop.
Yes.
What does it mean to titrate something?
To slowly increase the amount.
What do you tell patients when they're on an SSRI as to weaning them off the SSRIs?
Depends what the dose is. If it's a high dose, you need to slowly decrease the dose, so kind of the opposite of titration. But if it's a low dose to begin with, you can stop it.
Are you supposed to tell a person that's on an SSRI to stop immediately or to slowly withdraw from it?
At 50 milligrams, it is perfectly fine to stop it immediately.
So you didn't have any concerns at all about telling her to immediately stop taking the Zoloft? And what did you do? Put her on another drug?
Not immediately.
Okay. So did she relate to you on that October 28th meeting that you had? Was it the 28th or the 26th?
I met with her the 21st and then the 26th.
Okay. Now, on the 26th of October, what did she tell you her condition was?
So she was feeling back to how she was before the Zoloft, which is not great still, and that she was considering a new medication.
So she was considering it. Did she do research on medication as to what medication she wanted to take? Is that what you're telling this jury?
She didn't specify exactly what medication she wanted to take, but that she wanted to try something else because she was still having significant anxiety.
So when you say she wanted to try something else, I'm just asking, did you tell her what you recommended she try, or is that something that she decided she'd do on her own?
No, I gave her my recommendation.
Okay. The only reason why I asked that is that, a lot lot of times people might think that she's a psychopharmacologist, that she's a heart surgeon, that she's a vascular surgeon, that she knows everything about medicine. That's not true, is it?
No.
Would you agree with me that prior to telling her to stop the Zoloft, that one of the concerns that you had is that Zoloft affects anxiety and affects sleep, and you hope that it treats the underlying anxiety by balancing brain chemistry and increasing serotonin, right?
Yes.
Is that fair? And you'd agree with me that it does, as a side effect, have an impact on a person's falling asleep or staying asleep as a common side effect, right?
It can happen. It doesn't happen to everyone, but it certainly happens to some. But it is temporary. That's the important distinction. Is that there are many side effects that disappear entirely, and then the medicine is quite helpful for those certain conditions.
That's it.
Yes.
She had problems sleeping, didn't she?
Yes.
Even after the Zoloft, right?
Yes.
So you, not her, you recommended a particular drug that she should take, right?
Yes.
And again, as it relates to what one would expect a young woman who's a labor and delivery nurse to know about psychiatric medication. What is methazine? Do you know?
I'm sorry?
Methazine.
I'm not sure.
How about hermababite? B-A-T-E. Hermabate. How about that? You ever heard of that?
I'm not familiar with that.
That's what's used to administer to a woman who's going through birth. You don't have an obligation.
Sorry, had to bring an order in.
You have an obligation to know about psychiatric medications, though, right?
Yes.
There's a difference between what's known as meshes, which is not knowing what you have no reason to know, and ignorance, which is you don't know what you should know. That's fair?
Yes.
No, ignorance is you don't know.
So, did you ever gauge Lindsay's knowledge or ability to judge what medication would be good for her?
So that was my role.
Right.
I didn't expect her to know significantly the details about different psychiatric medications.
Is it important to know that a woman that's coming to you because of postpartum issues, shall we say, had prior problems, prior deliveries?
Yes.
And you'd agree with me that you're on the front line of healthcare for pregnant women when someone comes to see you, either pregnant or after having a baby, right?
They're usually referred by a therapist or an OB, but yes.
Okay. So being on the front line and dealing with these people, and you advertise that you deal with pregnant people before they have babies, right?
Yes.
And after, correct?
Yes.
Did she have any prior issues with her prior babies?
I knew that she had some anxiety symptoms with her prior, after her second child was born.
Dawson?
Yes.
And when she saw you after having Calvin, how old was Dawson?
A few years old, maybe 2 or 3.
Did she tell you what the side effects were after she had Dawson?
She did. I did not list them because.
That means you didn't write it down?
Yes.
So what is it? That way that we'll go by, right?
Sorry?
We'll go by your memory?
Go by my memory about what? I don't recall exactly which side effects she said, but I recall that they were some of the very common ones, the ones that are temporary.
Hold on. You're telling this jury that you don't recall what the side effects were that she told you, but your memory is that they were general?
They're general. That's why it wasn't a problem.
Yes, because if they were anything else, I would have documented it.
It was
And
anything concerning.
Zoloft. Did she take Zoloft, SSRI, after having Dawson?
I think she took it for about a week.
You think, or she did?
She did.
So isn't that something that would be indicative of the fact that there was some psychiatric issues after she had her second child?
Well, she took it for a week. Why would it bother her
Yes, but
this
she
time?
did not describe them as being severe.
Well, as a psychiatrist, can you ask her whether or not they're severe, or do you just wait for them to tell you?
Based on her description, they did not sound severe.
Tell me about bipolar. What's bipolar?
Bipolar is a mood disorder that has both depressive episodes as well as episodes of mania.
And is it your understanding that if a person has a difficult birth and in fact has some psychiatric attributes as a result of that difficult birth, that you should not prescribe SSRIs to that person because they could be bipolar?
Having a difficult birth does not, it's not a contraindication to an SSRI.
So after she had the second child, she took Zoloft, and you did not detail any side effects, and you don't remember the side effects. You agree that Lindsay had, at this point, a history of mental problems during postpartum,
She had a history of anxiety postpartum.
anxiety to the point that she described as SSRI,
Yes,
and she also had mental problems when she came to see you, right?
yes,
So she had mental problems after she had the second child, mental problems after she had the third child, correct?
yes,
And you can agree with me that this is not easy stuff for somebody to be talking about. People get embarrassed in our society with mental problems, don't they?
some do.
Some,
She did.
more commonplace than not
I'm not
now.
sure.
So, not documenting any of the side effects, did you think it would be important to document the side effects of the drug before you prescribe Zoloft the second time? Tell me she had. You don't know, but she had side effects. with
Why would she
Zoloft.
not know?
Was it important for you to document the second time that you're giving her Zoloft?
I did not feel that it was necessary to document the specific side effects.
So if
They weren't
someone comes to
concerning.
you as a person who is in postpartum and is all the symptomology that she had related to you, that if she told you that she was on Zoloft after her second child and had side effects, you don't think it's important to document the side effects?
Do you have your
right?
paralegal write down every note that you were?
It depends what the side effects are.
Which we don't know because you didn't write them down, you don't remember it.
I would have written them down if
No,
they
not
were.
what you would have done, what did you do?
No, overruled. Go ahead.
I would have written them down
What
if
did you do?
Will you let
I
her
wrote that she had
finish?
side effects.
What are they?
I'm not sure.
And then you prescribed Zoloft again, 2022.
She didn't write it the first time.
Yes,
You recall, in the period of September of 22, October of 22, into November of 22, that she used the word overwhelmed, told you that she was overwhelmed. Is that correct?
Most new moms
sorry,
are
which visit are we
overwhelmed.
looking at?
Well, period of time, September, October.
Especially
November,
with 3
she used
children now.
Terminology that she was overwhelmed.
Yes,
Okay. And when you were treating her, you didn't think that she was just merely overwhelmed with 3 children. You knew she was really struggling, didn't you?
I did.
And it was at that point that you just diagnosed her with a psychiatric condition. And you prescribed psychiatric meds. Isn't that right?
I prescribed psychiatric medications. Yes.
So when you prescribed the Zoloft, told her to increase it. She told you that she was having all these difficulties. You told her to stop. Did you give her therapy when you saw her?
She was going to
Yes.
therapy.
What did you do?
I think that I provided reassurance.
How do you think? I want to know what you did. That's why you write stuff down. So take time with everything else. What did you do? This young woman, the therapy.
On which day? Which day are we talking about specifically?
Came to you and told that she was overwhelmed, and you diagnosed her with a mental illness and prescribed psychiatric condition to psychiatric meds. What therapy did you give her? You told us that when you're on the television, you still give her therapy too, right?
I do.
What did you do?
Well, I'm having trouble identifying exactly when she said the words overwhelmed. So it's hard to pinpoint exactly what I said in a span of, a number of different visits.
Did you indicate that there's information on the website that a person has an emergency the patient should do something?
I did, and I advised her the same.
So basically, if one of your patients becomes suicidal, and then on that note, did she tell you at that point up to November of 22 that she was dwelling on suicidal thoughts?
It was a while before she mentioned anything about suicidal thoughts.
Tell us when.
I might need to look through the records to see when she first did. December 1st.
So on December 1st, what did she tell you?
That she denied feeling suicidal, but that she was close to feeling suicidal.
Close.
It's
I
kind
think
of
feel
like
close.
being a fisherman out in the ocean who's worried about the possibility of a storm and is thinking about the storm and is dwelling on the storm. Almost in fear of the storm, right?
Objection.
No vote.
Isn't it?
I guess.
So when she tells you
Right.
that.
How do you almost feel close to being suicidal?
Suicidal thoughts.
I don't understand that.
She denied having suicidal thoughts, but felt that she was getting close to it.
Okay.
I don't understand that statement.
Or thinking about it, right? Is that fair?
She was fearful of eventually having those kinds of thoughts.
What the hell does that mean?
Yes.
And how frequently with thoughts?
How
I'm
would
not
she
sure
know?
exactly how frequent they were. It's very likely that I did ask her the frequency.
You mean medical records? You see some patients, you have some patients under the Lindsay at that point, right?
Yes.
And you document when a patient, thank God, when a patient
Right.
tells you that she's in postpartum distress and she's close to having suicide thoughts to kill herself. That's important, isn't it?
It's important that I am aware that she's having these thoughts,
What thoughts?
that she is fearful she could become suicidal.
And she told you, I imagine, or you asked, how frequently these thoughts were.
I don't have it documented how frequently they were, but that is a question that I usually ask when we're talking about suicidal
We're
thoughts.
usually testifying in
Right.
a murder case. We usually have facts that we can tell a jury, not speculation.
Objection.
Yeah.
If somebody told me that though, I'd be like,
Did she tell you when you asked?
okay, how do you, that doesn't make sense to me. It
Yes.
doesn't make
What did she
sense.
tell you? If you don't know, tell us.
No, I I know, sorry, but it's what I said before, that that she denied having them, and she wasn't having them. We were meeting, but she felt close to it, close to having those thoughts.
That whole term doesn't make sense.
Would you agree with me that many times patients, especially psychiatric patients,
It sounds like a cry for help, and you're already
their
at therapy, so
symptomology.
where's the cry for help?
Patients sometimes do.
And sometimes when a woman has just had a child and has other little kids at home, you're worried about the government taking kids away from them because you're a mandated reporter, aren't you?
Oh, it's just the overall.
You're a mandated reporter, aren't you?
I am.
And if she told you, I'm having suicidal thoughts, I'm close to it, and homicidal, you'd report that, wouldn't you?
Not necessarily. I think it really depends on the context, but having suicidal thoughts alone is not a reportable condition.
All right, so basically, we know that she was close to having suicidal thoughts to kill herself, whatever that means. You
Right.
don't know how frequently she was having them. Yeah?
Today, I don't know how frequently, but at that point, I believe I did know how frequently they were.
So as a result of that, you then gave her therapy, I imagine, right? Through the television.
Yes,
And what therapy did you give her in November of 22?
I gave her supportive psychotherapy.
And what does that mean? It sounds great. What do you do?
It's listening to the patient and providing.
Sorry, listening to the patient, like when they say they're having.
Hold on, good. Sustain. Next question.
So,
the answer.
Right, next question.
thank you, Judge. Listening to the patient. That would be when, for example, one of your patients tells you, after all the treatment that you had provided prior to that, all the symptomology.
He's so condescending.
All of that she's close to having suicidal thoughts. That would, I imagine, impact on you.
Yes.
So what did you do with this psychotherapy?
So I provided emotional support and validation
What
and
does that mean? Validation?
encouragement.
What does that mean?
Something like, I understand this is a very difficult time. It really, it varies on the individual.
Sure. How about Lindsay?
I don't remember the exact therapeutic words that I used.
Okay. How long did you give therapy? Validation and all that stuff?
I don't remember exactly the duration.
About 10 minutes?
Maybe
Through the television, right?
To the television?
through the computer.
As we pointed out, you tell the people that come to see you, when I say you, I mean collectively Astor Medical, that you would expect that if a person is in crisis, as you guys say, or is suicidal, that they would have to go to a computer or their cell phone, right? They would have to punch in your office, right? Look up the number.
We advise them to call 911 or go to the emergency room as quickly as possible.
How about suicide hotlines? Do you give them advice to call them?
That's an option as well, yes.
Sure. Did she call suicide hotlines?
I was not aware that she did.
Did you ever ask her?
I don't think I specifically asked that
Well,
question.
not specifically. Did you ask her anything? Did you beat around the bush maybe? You ask her anything about suicide hotlines?
I don't think I asked her about suicide hotlines.
Would it surprise you to know that she called suicide hotline in that time frame, not once, but twice, and was turned away? You guys were on the front line of this, aren't you?
No, overall.
It does surprise me, yes.
It does what?
It surprises me that she called them twice.
You never asked her if she had ever called a suicide hotline, did you?
I don't think that I did.
I understand. You're a doctor. You were trying to do the right thing. You obviously, this is just horrible, isn't it?
Yes.
She continued on with her treatment with you, correct?
Yes.
What was the next medication that you put her on? Say we're up to, I guess would be the October 26th date. Is that right? Is that when you prescribed Ativan?
I prescribed that on the 21st.
Sorry?
I prescribed the Ativan on the 21st.
All right. Did you prescribe anything on the October 26th appointment?
Yes.
And what was that?
Buspar.
Buspar. And would you agree with me that, is that also Vanspar?
Buspar or Busparone are the common names for it.
Okay. You ever heard of Vanspar? V-A-N, V as in Victor, A-N-S-P-A-R? You ever heard of that?
No, I haven't.
Okay. And would you agree with me that there are a number of side effects of Buspar?
Every medication has side effects. But
Okay, so my question is pretty simple. Buspar, you mentioned it, I'm asking, any side effects?
yes.
What are the side effects?
They could be tiredness or dizziness or rarely some upset stomach. But it's generally a very, very well tolerated mild medicine.
And do you recall, was she taking any other medication at that point, if you know?
Yeah, she was taking some of the Ativan.
Some Ativan, right? Did you prescribe that to her?
Yes,
When did you prescribe the Ativan to her?
the 21st.
And she was compliant with your recommendations, right?
Yes.
Was she also reporting to you that she was taking Benadryl, like over-the-counter stuff?
It was being used as needed, yes.
So that's PRN, the record is PRN, or whatever you take it as required, right?
Yes.
And she reported to you that she was taking Benadryl, right?
She reported that, yes.
And you didn't document how much she was taking, right?
It's only available as one dose over the counter.
Okay. Did she re-up the dose over the counter, do you know?
She didn't tell me that she did.
Did you ask her?
I don't remember asking her about if she increased it. I think she was just taking one of them.
You think? Did you know that Ativan and Benadryl are contraindicated, that they can have a serious impact to the central nervous system and depressant effects?
Yes, but can I explain that when they say depressant?
Excuse me, the answer is yes, right? Is the answer yes?
Yeah, if the answer is yeah, if that's the question, the Commonwealth may be able to ask you further questions if you'd like.
Well, I can't say yes to that entire statement.
Next
Did you
question.
discuss anything about Benadryl combined with Ativan on October 26th?
I don't recall.
On October 26th, was she still worried about suicidal thoughts?
She denied that.
And on October 26th, how did she deny that? Do you have that noted in your record?
I do.
And what does it say?
Patient denies suicidal ideation.
Okay, so there's a huge difference between suicidal ideation and somebody having thoughts of suicide or being close to it, right?
Not exactly.
Well, you knew that the last time you spoke to the woman, she told you that she was close to having thoughts of killing herself, right?
Yes.
And you're her doctor, right?
Yes.
So what do? You just say, do you have, and check the box, and say, do you have any suicidal ideation? And she says no, and you check the box?
No, it's not that simple.
Do you ask her, like, well, gee, the last time I spoke to you, you told me that you were close to having suicidal thoughts of killing yourself. Did you pursue that on the 26th of October?
Yes.
What did she say?
That she wasn't.
Now, how long was that appointment, if you recall? Would you agree it was 17 minutes and then there was some therapy?
The entire appointment was something between 25 and 30 minutes.
And that was again through the television, right?
The computer, yes.
Computer. Did you also add a drug called Hydroxyzine?
Yes.
When was that?
So that was the same visit as an alternative to the Benadryl.
So on October 26th, when she told you that she was taking over-the-counter Benadryl, I asked you what you prescribed to her and you said Ativan, right? Right?
Yes.
And then I asked you about the contraindication of Ativan and Benadryl, right?
You asked me about that, yes.
And then you, on October 26th, started her on Buspar, correct?
Yes.
And what is the purpose of Buspar? Is that for anxiety?
Yes.
And what kind of drug is Buspar?
It doesn't really fall into a class, but it does act on serotonin.
So it's another, similar to an SSRI, right?
It's kind of like a more mild version of an SSRI.
Okay. So she's on Benadryl over the counter, Ativan, which is a benzodiazepine, Buspar, which is an SSRI, and then you prescribe hydroxyzine on the same day, right?
They weren't all to be taken at the same time.
What's hydroxyzine?
Hydroxyzine is an antihistamine.
Okay. Is that over the counter or is that, can you just buy that over the counter? Or do you have to go to the back where the pharmacist is?
You have to go to the pharmacist.
Okay. And as far as you're concerned, she was taking the medications as she was required, right?
That's what I was told.
I'm sorry?
Yes, that's what I was told.
Did you, by her?
Yes.
And did you at any time tell her that she should keep a diary of her medications and keep a diary of any side effects that she has?
I didn't instruct her to do that.
You don't have to instruct somebody to do anything, but did you recommend it? Like say, hey, you're on all these meds. If you're having an effect, you should write it down. When, time, date, anything like that?
I didn't tell her to do that.
Would that be helpful?
Maybe, but usually we go through all of that in the appointments, and we met very frequently.
Now, you'd agree with me that at this point, prior to the next appointment, which was November 2nd, she had gotten significantly worse, even after all this medication that you had been prescribing, right? Did you make a note that she was telling you that she had depression and that she was crying, had more anxiety, insomnia had increased, brain fog, and worrying about suicide?
In the couple weeks after starting those medicines, I don't recall that the symptoms were significantly exacerbated.
Okay. Friday afternoon, you answered the DA and you said that you recall that she used the word brain fog, right?
She used that at some point. I don't recall when.
Okay, what is brain fog?
It's it's a very subjective feeling that someone might have where maybe it's, hard to think of a word that you're trying to think of, or maybe it feels like maybe you're thinking of things a little bit more slowly than you normally would.
And how often was she dwelling on suicide?
At what point?
At what
When she
point?
told you that she had anxiety, insomnia, brain fog, crying inconsolably?
So you get to that.
Yeah, where's the crying inconsolable?
October 26th, heading into November 2nd. Do you recall, I'll rephrase it, do you recall going into the November month, meeting with her, and she told you that she had
Can we
brain
slow
fog?
down, let her look up October 22nd or whatever, 16th, whatever the fucking date was?
It was
Jesus
mentioned at
fuck.
some point. I
Okay.
don't see that on the 26th specifically.
All right, so let's talk about brain fog. Did you ask her what that meant? Because when you say subjective, that means that's her interpretation.
Her
That's in
interpretation of
head.
it. I have brain
Right?
fog. I have celiac
Yes.
As opposed
disease.
to objective, which would be.
And if I get gluten, I have brain fog.
Yes.
So when she's telling you,
And
in
it
addition
does,
to
it
the
makes you feel
anxiety,
like
in
you.
addition to the crying, in addition to
And
the
if
stress that
lost
she was
for like
undergoing,
this, you're like.
she was worrying about suicide. She talked about brain fog. So you must have asked her, what does that mean?
What does it mean to you?
Subjectively, what does that mean?
Subjectively means in the patient's, own opinion, that's what their experience is.
Okay,
I
so
mean,
she's
there's
the
a
one that's
definition
inside her
for it,
head,
but
right?
it's
Yes.
to each their own.
So what were the
Can't think of
symptoms? What
words,
is
forget my keys, go
When a
into a room,
patient
forget
tells
why
you
I'm
that they have
there.
brain fog, is that something you would consider as being a potential side effect of the medications that you would put her on?
It could be anything.
It depends.
Could be the
Or
fact
what?
that she has a newborn baby and she's not sleeping.
Sometimes it could be, and sometimes it could be unrelated. It's a symptom of depression as well. So sometimes it's hard to tell what it's attributed to.
Yeah, brain fog happens for
So
many
at this
reasons.
point, heading into November, your answer was to prescribe more medication, 3 more drugs, right? You prescribed Ativan, or increase the Ativan.
Exactly.
What
In our
was her load
darkest
for Ativan
hours,
at
we
this
still
point? Do you
have
remember?
agency. Remember that.
Sorry?
What was her milligrams, if that's right, or nanograms, whatever it is, on the Ativan, on the script that you had provided her?
I still question.
You can answer that.
There's a lot of,
Which date are we
there's a
referring
lot
to
of people.
for the Ativan? Because
You
there were,
objected.
I'm
She
sorry.
already objected, he already said you can answer it. When
Wow.
did you increase her Ativan into
Question's
what
gonna be spicy
level?
today.
So she was prescribed Ativan 0.5 milligrams.
Right,
21
And
in office.
then
Yeah.
when I next saw her, she said it was a little bit helpful. So I said you could increase it and see if 1 milligram is more helpful.
did she increase it?
Yes.
And when was the next time you saw her? To talk to her on the television or on the computer?
Well, I saw her on the 26th, and then I saw her on the 31st.
Oh, no, he's wanted at this lady. She's
Right.
part of the
How was she on the
civil
31st?
lawsuit, which is why he tried to
Colleen,
regulate
how
her.
was she?
That's not my note, that's her therapy note.
Okay. So how about this November 2nd? Was that the next time you saw her?
I saw her on November 2nd.
And she
No.
told you that she was hesitant to use the
Ativan, it's a
medications,
sleep
the
aid.
Buspar and the Hydroxyzine, right?
Ain't it? I don't know. I don't take drugs.
She said she was hesitant to try the Buspar.
She was scared of the drug. She was scared of the drugs, right?
She was afraid to take a medication.
She wasn't doctor shopping and asking you to give her drugs so she could get high. She was asking you for help.
Okay, it's used to treat anxiety
Yes.
disorder.
And she was afraid to take the drugs and told
It's a
you that she was
benzo,
afraid to take the drugs,
diazepine.
right?
She told me she was afraid to take the Buspar.
Did you advise her or
Yeah, produces
counsel her
calming
or give her
effect.
therapy about that?
Reduces
Validations?
nervousness and tension, anxiety.
Yes.
And what did you tell her?
Well, I advised her of, the risks.
What were the risks?
Well, the risks of medicine, like we had said, sedation or dizziness.
Oh, I believe a husband
Okay.
pill too.
How about interfering with sleep?
Buspar doesn't usually interfere with sleep.
Not usually?
I have questions.
Did you ask her about any thoughts of suicide or being close to having thoughts of suicide?
Yes.
Did she indicate to you that she had any thoughts of suicide at all?
Not at that date.
The
Did
problem
she
is
use
she's
those words,
in
or is
labor
that
and
a box
delivery
that you
nurse.
checked off?
I question.
I don't remember her exact words, but we talked about suicide or, thoughts of hurting yourself.
Right, and there's a distinction between, in your records and the notation, between suicidal ideation and I quote, worrying about, thinking about suicide. Would you agree with that?
Yes.
And what did she mean when she told you, as her doctor, that she was worrying about, thinking about suicide?
Yeah.
You mean in the prior appointment?
I'm talking about a woman that's sitting in front of you on your television or your computer telling you that she was worried about thinking about suicide.
Well, on the second, she didn't say that.
Okay. When was the next time that she told you that she was worried about or thinking about or suicidal ideation?
I think the third child was too much.
That was the December 1st visit.
Okay. So go back to the November 2nd visit. Would you agree with me that she, after you talked with her for that period, however long it was, that you then brought up 4 medications to her, recommending that they might be safer, and I quote, safer alternatives? Would you agree with that?
I see the word alternatives, not safer alternatives.
Do you remember talking to her about Remeron?
Yes.
Did you recommend that she take Remeron?
No.
Right?
Did you ever prescribe Remeron?
No.
And is that mirtazapine, as far as its generic name?
Yes.
And Remeron is an antidepressant, isn't that right?
Yes.
And you did not feel that that would be an appropriate medication for her to take at that time?
It was a very reasonable option, but we didn't decide to start it.
So is this a collaboration? In other words, you and the patient, you would both make a decision
All
as to when to
all
start?
doctors
the
anymore
drug?
collaborate.
Or
They
is it your
don't give a
decision and
definite
advice to the
anything.
patient?
Well, it's ultimately my decision, but the patient's
Has a
thoughts about the matter are very important. At the end of the day, the patient has to go home and take it themselves. I'm not there to ensure that that is happening or not.
So you had a November
That's how all
22nd
doctors feel
appointment, right?
nowadays. Because everybody's doing malpractice bullshit.
Yes.
And it was at that time that she told you that she had been to see South Shore Perinatal Clinic, right?
Yes.
And did she tell you why she was seeing someone from the South Shore Perinatal Clinic?
I think she told me that it was because they were exclusively focused on treating perinatal conditions.
Yeah, but so were you, right?
Not exclusively, I'm a general
I
psychiatrist.
see. And did she mention the name of any doctor or nurse practitioner that she was seeing at the South Shore Perinatal Clinic?
Yes.
Who'd she mention?
I think she said something about Julie.
Paul?
Yes.
Okay. And a woman by the name of Nurse Jawada?
I heard her name a little bit later, but yes.
Did she advise that, in fact, by script, she was using Ativan and Benadryl, and you told her to taper off the Ativan at that appointment, right? Had she tapered off the Ativan?
I think I told her I gave her a prescribed taper prior to that appointment.
What does that mean?
Didn't.
What does that mean, you gave her a prescribed taper?
So I told her that she should reduce her dose by 0.25 milligrams every 2 weeks until the medication was stopped.
Did she do that?
You're not.
I don't believe that she completely stopped it, no.
No?
So
You
she
don't
didn't
believe or
listen.
she didn't?
Well,
Trying to give the jury facts.
yeah, she said she was taking Ativan, so no, she didn't completely stop it.
Had she tapered?
I'm not sure how much she had reduced the dose because I wasn't prescribing it again.
Right. So did you know that she had been, or had she been, to any emergency wards between that period of time that you last saw her and when you were seeing her on this meeting?
So that's your
I know
client's
she went
fault.
to the ER, but I think it was after that.
Okay, which ER did she go to, do you know?
I think she went to Mass General.
Do you know why she went to the ER?
Because of depression.
So was she treated at the ER? Did they make any, to your knowledge, as her doctor, make any recommendations?
I'm not sure what they told her, but they ultimately
Go ahead,
discharged her. They didn't admit her.
go ahead.
Sorry.
That's all right. Was she put on any medication?
Not from the ER.
When you looked at the records from South Shore Perinatal Clinic, what did they indicate about suicidal ideation, worrying about suicide, close to suicide, anything?
I didn't have access to those records.
You're gonna keep your voice up so everybody can hear you. You what?
I did not have access to those records because we're a completely separate clinic.
Seriously?
Oh my
She's
God.
visiting with you as a patient and you can't access her medical records?
Objection,
Is what you're
Jesus.
telling this jury?
I did not have access to them, no.
Could she have signed a release, a HIPAA form?
Yes, she could have.
And you could have got the records,
Yes.
but you didn't.
I did not feel like it was necessary because she provided all the relevant information about her treatment there.
How do you know? She's got mental disease and she's on all this cocktail of drugs. How do you know that she is an accurate historian at this point?
It felt very accurate when she was able to recall the names of the medicines, doses of the medicines, specific days. She provided a lot of incredibly detailed information. So it showed me she was capable of doing that.
So when you talked to her husband, Pat, how many times did you talk to her husband, Pat?
I
The
think
guy was living with her.
The guy that was living
I
with
think
her.
it was once.
And he came to your office, right? No, he didn't. He got on the television on the computer screen, right?
Television.
Yes.
And when was that?
Okay, Matlock.
I think it was the December 16th visit.
So let's,
Reddington, before we get to that,
okay.
probably a good spot to stop. We're gonna take the morning recess, and then we'll come right back, okay?
All right.
This is crazy. Matlock, he was on the television. No crying from her today. No emotions from her today. Oh, are you okay? Get out of here. See, I have this hard problem because she was a labor and delivery nurse. She knew that she had some kind of issues. She would have known a lot of these drugs being a labor and delivery nurse. She would have known a lot of the symptoms. And if she had problems with her second delivery, why would you do it a third time, for one? But on the third time, wouldn't you be prepared that you were going to possibly have some kind of mental issues and get ahead of it? But also, like, why wouldn't you just stop at 2? So you wouldn't go through it. So I have a lot of questions because, see, there's too many people that cover up a lot of crimes by using mental issues. And I'm not saying that's what she's doing here. I'm just saying it seems a little convenient. And also, her husband, like, doesn't seem to be in the picture. And the only reason I say that the mental may be a cover up is because everybody that's been on the stand so far said they had no idea. She, like the person she went on play dates with, the people who've known her for 17 years, her nanny. I mean, even Patrick got on the stand and lied and said the nanny wanted more time, so they had to let her go because they couldn't give her more time. Nanny gets on the stand and said they went for a walk, came back and said they'll have to let her go because they didn't need her anymore because she was going to stay home and not go back to work. So that contradicts what he even said on the stand. And then she went from doctor to doctor to doctor. And this is the problem. If you don't stick with a plan, and then she even wrote that in one of her diaries or whatever, or talked, or one of the people that she talked to, is that if she didn't stick with a plan and just hang in with it, and you go from, it's kind of like training a puppy. If you talk to 15 people about training a dog, well, the training's not going to work because you're doing 15 different things. And see, that's the thing too. So there's a lot of conspiracies out there. A lot of people believe that the husband had something to do with it. I don't believe that because he wasn't in the house with this and all that, but that doesn't mean that the kids weren't dead prior to. He even left for the house, all this stuff. I don't know. I mean, it's just all weird, too convenient. Like, I mean, it's gonna sound weird saying it's convenient because she's paralyzed from the waist down. But the thing is like most people can fall off a ladder. I mean, shit, people can fall off a house and not do that. What the hell she did to her body? Well, I don't like the husband at all either. He's sketchy as shit. Like, I didn't like him on the stand at all. And he wasn't like involved. He didn't even know what book she had. He didn't know anything about, like, even the notebook that her and the nanny had back and forth. Like, well, it looks like her handwriting. I don't know who the other person is. How do you not know that the nanny and her are writing back and forth? Like, how are you that disassociated from your own life that you don't even know the schedule of your own kids, that you don't know anything, and you're actually working from home for how many months? You don't even know anything about your own life and the lives of your children? That's sketchy in itself. So that's weird. Like, there's just a lot of questions behind it. And the thing is, like, and I say this all the time, it doesn't matter if you have PTSD, if you have all these mental issues and stuff like that, in your darkest hour, you have agency over your own actions. You can't tell me she sat on the floor, wrapped these cords around these poor babies' necks, and didn't know what the fuck she was doing. Because she's crying in court now. You know, she's like, holy hell. She's disrupting court over it now. You know what I mean? Like, in your darkest hour, you still have agency. And that's the problem with the world today, is that we're doing this whole thing of there's no accountability because we all have mental issues. Well, there's a lot of people in this world that go through mental crisis. There's a lot of people in this world that didn't grow up with a great childhood, that had horrible lives growing up, and they're great productive members of society that, you know, grew up and got out of a bad situation and are great members of society that didn't hurt anyone or don't hurt anyone. Your past does not dictate your future. So this whole thing of, well, let's see what their childhood was like, that doesn't dictate what you are today. Your own The way that you conduct yourself is what dictates who you are. Right. And that's the truth. You know, I didn't grow up in the best situation, in the best household, in the best whatever. And I have never gone out and hurt somebody. I've never gone out and, you know, killed someone. I've never gone out and done horrible things to people just because, well, I had a bad childhood. You know, like this whole thing that we have this right to do harm to other people just because. Right. Well, exactly. You, right? And that's the thing, right? So like you're not out here like, you know, destroying the world because you know, had a mom that left you at 1. You're not using that as a crutch to, and that's the problem, is that now we have people that there's no accountability for your actions. Hey, what's up, K9? Working your butt off? I agree too. It was nice for you to stop by. I appreciate it. I mean, I definitely think that there's just a lot of questions, a lot of things unanswered, you know? I mean, it's no different than that Courtney Clenny case, you know, she's taking a plea deal today. You know, it's going on the same time this is, and she's that OF chick that stabbed her boyfriend in the chest with a paring knife. A paring knife, so you know, like one of those tiny little knives, right? And she's taking a plea deal. Instead of going to trial, instead of actually getting what she deserves, she's getting a plea deal. And she deserves to go to prison for the rest of her life. She stabbed him, killed him. He bled out. Her interrogation, oh, she's sitting there covered in blood. She could give a shit less that she killed this man. And for no reason. I mean, like her apartment was totally covered in cameras because she's OF chick, which is OnlyFans for people who don't know what OF means. We should now in this day and age, because everybody's OF something. And I mean, even in the elevator and stuff like that, she's beating the crap out of this dude. He should have left her long time ago. Feel so bad for this guy. And she's just taking it out on him like every chance she gets. And then she stabs him. Oh, something right. It's true. And after she stabs him, I mean, he's laying there bleeding out, all this stuff. She gets online. Like she goes live. Tell me that doesn't deserve the death penalty. A poor man is like dying. Because she stabbed him in the chest. A paring knife. And he's dying. And she decides to get online. Go live. Because that's the world we live in today. And she gets to take a plea deal. I don't understand what's wrong with the world we live in. It's gone crazy. That's the truth. Minimizing. It's like the 3 kids that broke into a veteran's home and he shot and killed them. And her whole thing is, they were only stealing from you. You didn't have to take their life. Wait a minute, what? They were only stealing from you. Think about that mentality. They were only stealing from you. He was 76 years old, You're breaking into his home with guns. You're shooting at him. Then you beat him up. And because he defends himself and your children die from it, you want to sue him for wrongful death and you want him prosecuted. And it's his fault? You're breaking into his home. Right. No, I agree. Oh, are you talking about the one in Ohio? She's going 100. Mackenzie Shirella. She was going 101 miles an hour. Killed her boyfriend and their friend that was in the back seat. And she walked away from the crash. Yeah. Yep, Mackenzie. Yep. That's not too far from me. And in my opinion, she didn't get enough time. She killed both of them. I mean, she's up for parole. She'll go up for parole in 15 years. She won't get parole. I don't believe she'll get parole in the first. Because she still doesn't believe that she did anything wrong. Ohio's kind of strict to that. The father and the mother, the situation were both sketchy, and I think they let Javi to testify against her. Well, that's what I don't know. Might be. Oh, the mom and the dad are worse on the Mackenzie, right? Oh my God! Did you know they have another daughter, an older daughter? And they treated her like you'd never know about the other daughter because they act like they don't even have anybody other than Mackenzie. They have an older daughter. I think she's like a year or so older. Yeah, you too, T. Yeah, I don't know, Canine. Because he didn't help either side, in my opinion. And I think he perjured himself on the stand, especially with the nanny. There's so much about the case that I'm not saying that there's not postpartum. Did you see that doctor? Was he a doctor? I think he's a doctor. He killed himself, his wife, and their 6 kids because he was cheating on the wife. She found out about it and so she's going to leave him. So he decided to kill everybody. It just happened. I don't understand the whole idea of killing the children, killing the spouse. Just leave. Yeah, this guy right here. So he killed her and their 6 kids and then killed himself because he was cheating on her. This is the second time. So he decided to kill her and all their 6 kids. Isn't that crazy? Oh. But yeah. "47 years old. Oh, he's vice president of sales and marketing at American Heart Association. That's what he was. I was thinking he was a doctor. Right? Like, how could you just, like, and that was the thing too, is, oh yeah, he burnt down, he'd started a fire in the house. Like, he was going to cover it up and then he just killed himself. I don't know. Like, people are just wild anymore. I don't understand the whole, like, just leave. Why do you have to, why kill the kids? Like, I don't understand why everybody's killing the kids. They told me they wanted to hurt their kids. I do what I needed to keep those kids safe. But some, openly talked about hurting the kids. It's just weird. I agree. See, that's why he's sketchy to me. Like, because I couldn't even do that. Like, I keep saying this. I've been saying this since the trial started. For me, even if Aaron said to me, I have thoughts of hurting the animals, I'd be like, well, you can't stay here. For one, but for two, I would never leave him alone with them. Ever. Like, unsupervised. Ever. But he just wouldn't be here. Like, and they're animals. I couldn't imagine if I had kids. If somebody said that to me and had kids, and we had kids, like, I'd call the police. I'd call the police. I'd just be like, I don't feel safe. I mean, like, who just says, okay? And all he said on the stand was that he asked her if she had a plan, and she said no. Now, I mean, you could say that if it was about you. Like, do you got a plan? No. Okay, well, maybe you should think about getting some help or something or whatever, what's going on with you, blah, blah, blah. But when you talk about hurting kids, like, if you'd ever say that, if my friend would say that to me about their own kid, I'd be like, CPS. Talk to their spouse, like, hey, look, you need to get some help, talk to their parents or, if they didn't have a spouse or whatever. But, like, you just don't, like, leave innocent. Like, you just don't, like, that's just not something you just nonchalantly just, like, let go by the wayside. Too many people are like, mind your own business, stay in your lane or all this bullshit. Now, when it comes to kids, they're innocent. Right? I mean, I don't understand the whole, like, who just says, okay, and then, like, I would be like, and then say, how was it not like a red flag to him that we're going to a restaurant we haven't ever been to except for 3 times when we're out doing stuff? That was his testimony on the stand. We're out doing stuff. So we go to this restaurant because it's further away from our home, to a Walgreens that's further away from the home that we don't go to. We usually go to the one that's right next to the house or right by the house. So we're going clear out here. So I have to go clear out to this Walgreens to pick up this one thing, to get for the kid, which is so odd that she made him go there. When, like, tell me she didn't know she was going to kill the kids. I mean, just tell me she didn't know that. Because she did it while he was gone. She purposely sent him out to this Walgreens clear out there so she had enough time to do it. You can't tell me she didn't know that she'd had it planned, that it wasn't premeditated. It's not like she sat there and went, well, since he's gone. Because clear out there to get to the Walgreens, then drive back to go to whatever the restaurant was to pick it up, all this stuff, then time to slit her wrist, take the pills, all this stuff, and then jump out the window. She knew she had to have an extended amount of time to do all this. I'm just saying, there's a lot of questions that haven't been answered. And she said that she heard a voice that said, if you don't do it now, you'll never get the chance. Chance for what? So if you don't kill the kids now, you'll never get the chance. Chance for what? I mean, I don't know. I just find it all weird. There's a lot of questions. And if I was the dad, I would have been like, sure. I mean, I'll go get them. Like, let's all go together. Or I'll go get all this stuff, but kids are getting in the car with me. After somebody tells you that, you just don't like extended period of time. He was already home with them, all this stuff. Okay, cool. We're all getting in the car and going together. Just my personal opinion. May not be a popular one, but I'm not leaving anybody with. After you say those kind of words, those are words you forget. And right, exactly. I agree with that too. Right, and that's the thing. Just because she was asked, well, do you have a plan? And she said, well, no. Doesn't mean she didn't think of it. Exactly, I agree. Because who's going to come out and say, well, yeah, I have a plan. Here's like K9 said, here's the step-by-step itinerary. And that's why when somebody says that, you take them at their word. When they say shit like that, no thanks. So then that leaves, and that's why I said he was just so disassociated from his own life that it didn't even occur to him to think, hey, she said this to me in October. And it's January. If he came home and started working from home, what, you just get to the point where you just up and leave? No. I wouldn't do it with my animals. All them kids. If you said, I'm going to shower, and then I say, well, what's your plan? And you say, I don't know. I just want to shower. Should we think we're going to shower? Right. Right. But, and the thing is that is so like nonchalant compared to, dude, I don't know what I would do. I can't imagine, like, I don't have kids, but if somebody said that to me and I had kids, I would be like, I don't know. I think I would just call the police right away. Like right away, I would just be like, you need to come get this person because I'm not sure what I would do. Do you know what I mean? Like, who says that? And it's just so nonchalant, like he made it sound on the stand. Well, she said it to me. And what did you do? Like there was no like follow. But see, I think this is a problem nowadays too. Like I ask so many questions. Like there's so many things so far in this trial that I'd be like, and did you ask? Did like even her friends like and family didn't ask any follow-ups. Like I'm a person, I ask a lot of questions. I ask a lot of questions. Like if something doesn't make sense, something doesn't sound right, whatever, I'm always asking questions. But people take questions as an attack now. Like you are not allowed to ask questions. Like people are just allowed to say shit and you're just like, you're supposed to accept it. And I'm like, no, no, that doesn't make sense. Why would you say that? I don't know. Because I don't know. I would just be like, excuse me for a minute. I need to make a phone call. Because you will get the fuck out of my house. Just saying. I don't care who you are. Thinking about hurting children. We got issues. I mean, animals and children are the most innocent thing on the planet. And if you think about that, that's horrible. Like something should seriously happen to you. Right? Well, that's what I'm saying. Kicking you out, locking the door, calling the police, letting them know, like, hey, getting a PPL, like there should be like steps, not just, well, I shouldn't have a plan. It's good. It's good. No. That's why I'm saying this wasn't taken serious at all. So that's why I have so many questions. Right? And the thing is, they were married, right? So, like, 151 her ass, like, minimum of 72-hour hold, right? Because, like, you say that's not funny. That wouldn't even be funny. I'd be like, 151 right now. I don't even care if you got a plan. Like, that wouldn't even be a funny thought. But see, there you go, right? That's 151. You're married, 151. I need a 72-hour hold right now. Call the cops. This is what they said, 151. I'm not sure he's in his right mind, right? Like, I'll sign the papers right now. It's easy. After 72 hours, they can determine whether or not he needs to stay longer. Because, like, who says that? Not, do you have a plan? I don't care if you got a plan. I have a plan. Right. Well, and that's why I say, so like the whole postpartum, and there are so many people, like you should see other like streams that are talking about it. They're like, we're behind you 100%, you know, all this stuff, we understand and all this, Lindsay, we're behind you 100%. And I'm like, how? How are you behind her? Like something seriously went wrong, and I'm sorry, but even in your darkest hour, you still have agency. you have to understand, it wasn't, she didn't use this. She didn't like give her kids, they did toxicology on the kids. She didn't give them sleeping medicine. She didn't use this. She used bungee cord looking exercise bands. And then she tied them. I know. And then she tied them. The 8-month-old maybe didn't, but then, the one EMS or a police officer said that one was hanging, which is horrible in itself. But the 3-year-old and the 5-year-old, you have fight or flight. You are going to gasp and pull and want to do this. You have to think about this. She didn't have any scrapes. She didn't have any scrapes on her face or anything like that. Them babies trying to save themselves, because you are going to have fight or flight. Your body, your own preservation of survival, your own body's going to kick in. Even at 3 and 5, your body, your brain is going to kick in and try to survive. And it's not going to be like a minute. It's not going to be like 3 seconds and they're going to, suffocate. They had petechia in the eyes, all kinds of stuff. Like, she strangled them. So either she strangled them and tied it, but you have to think about it. Those kids trusted her. So somehow she got it around their neck and then tied it. We have to think about how she did this. Because that's what everybody keeps, like, they keep looking at her. Like, her stupid defense keeps going, she's not going to get up and walk out of here. I don't give a shit. Her babies aren't going to live a life. Exactly. And that is the part you have to think about. I mean, just try to do it to yourself. Not try to do it yourself, because, like, literally, don't try to do it yourself. But I'm just saying, this is an exercise band for stretching your legs and your feet, like all kinds of stuff. This is an exercise band. She used ones that look like bungee cords that you do on tarps, and then tied it because they had to untie it. So it was tied like this, but not like you do like your shoe, but without putting the bow, right? So it was tied like this around their neck. Yeah, I agree. I think so too. So here's my theory. I think she sat them down, did it, because they were all found on their face down. Like the one, like Cora, the girl, she had all blood coming out of her mouth. That's what the whole red carpet was, right? So she had blood coming out, and they had to clear her nose and mouth, blood. And I think what she did was she tied it really tight. They couldn't get it off, and they strangled the one, the baby was hanging, and she went upstairs, and that's when she did the whole. And I think that because her levels weren't high enough to be overdosed or even register except normal, I think she did the whole pills in the cup, all that stuff, and dumped it out. I don't think she actually drank it. And then slit her wrist, looked at herself in the mirror as her blood was bleeding. That's why it was drip patterns on top of each other. And then climbed out the window. And then I think because the reason that she's climbing out the window, she's holding on, she looked down, seen the window well, thought, shit, I don't want to fall on that window well because I'm literally going to hurt myself. And then just kind of flung herself off the window well, or off the windowsill, and then actually fell and hurt herself, and probably slipped weird because of how she fell backwards. Because that's why there's smears across that windowsill. Because if she's bleeding and she goes like this and shimmies over a little bit, looking down, seeing that window well, that's just my opinion. It's a theory.
Session, please proceed.
I wasn't there.
Y'all sit for the jury?
Yeah. Face down, cover them up, all kinds of shit. Yep.
All right.
And then I think she left and went upstairs. Because she had no scratches on her arms, no scratches on her face. Because if they're sitting and she's holding that, they would be doing this. Think about even when the strangler did all that stuff where they were behind her neck like this, you would be reaching like this. Her 3 and 5-year-old would be for sure.
Let's close now session, please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth.
Sorry to be graphic.
All parties are present, including the defendant and the 18 jurors.
All right, thank you. Mr. Reddington.
If you would just please look at the
Mhm.
in front of you, just go back to that.
Oh my God, talk into the mic.
I had trouble hearing the date. Can you repeat that?
October 28th.
Everybody have a hard time hearing because he don't like to get up to the mic.
So looking at the interview history, that's when that you decided to start Zoloft. Said a week ago, right?
That's when the patient started it, yes.
Okay, and she then increased the dose, and it says last night, right?
Yes.
And what was she telling you on the computer screen when you were talking to her? What did she say about increasing the dose of Zoloft?
That she felt awful. She couldn't sleep, had insomnia, which became worse when she increased the dose. She didn't want to eat. She was having diarrhea. Food felt really unappealing. She was more depressed on it, crying all day yesterday, which is not normal for her. She had some mental fog and
Maybe.
was terrified to start something new.
Did she also tell you about her anxiety level?
Anxiety was really bad even before med. Now hard to differentiate. Overnight racing thoughts, paranoid of getting suicidal
I'll be right
thoughts. Something bad happening.
Doesn't want to be alone.
That must have given you concern that you had a pretty sick patient on your hands at that point, right?
I was concerned, yes.
So you gave her some therapy, did you?
I gave her some therapy in conjunction with discussing all of her symptoms and assessing her and managing the medication.
Okay, and again, I apologize. You have to keep your voice up so people can hear you way down here. So when you say you were talking about the symptoms and what did you do? Just talk about the same thing that we had just gone over, the symptoms?
Well, there were a number of them to discuss in more detail. That's the summary of them.
Okay. So did she discuss it in detail?
Yes.
Did she tell you that her symptomology at this point on October 20th was so bad that she had to have her mother come and stay with her?
Her mom was coming to provide support. Yes.
She wasn't coming to provide support. She was coming to stay with them, to live with them, wasn't she?
Yes. I don't know for how long, but yes.
Did you bother to ask her? Why is her mother having to stay with her?
Because she needed some help.
Do you know how long the mother stayed with her?
I don't.
Do you know that she ended up sleeping in the basement?
I don't.
Do you know that she ended up sleeping with her mother?
I don't.
So you decided that you'd stop the Zoloft and you would monitor closely, right?
Yes.
What does that mean, monitor closely?
Well, I saw her the next day, so that's monitoring, an example of
Okay.
monitoring closely.
So this would be on October 21st that you saw her the next day. Is that correct?
Yes.
Now, on the 20th, you made reference to the fact, you also recommended that she try fish oil and things of that nature, natural remedies.
Yes.
You also wanted to look into what's called Zulresso, Zulresso.
Yes.
What's Zulresso?
It is a treatment for postpartum depression.
And when you say you were looking into it, what did you do? Did you find out it was available or did you participate in the program?
I did some digging online to see where it is done and how to do it. I hadn't officially recommended it, so I had not started that for her. It's not really an easy medicine that I could just start because, sorry, it's not a medication I could start on my own. It is, it's infused through an IV in hospital, so it's a bit difficult to coordinate.
It's a 60-hour infusion, right?
It's a long infusion, that sounds right.
And it's about 2.5 days of infusion. It has to be under hospital circumstance. And the only hospital around here is in Rhode Island, right?
Yes.
And did you ever recommend that she do that?
It was something to consider. I couldn't make the official recommendation because that's not something I prescribe.
Why?
Because you can't pick that up at the pharmacy.
Well, no, obviously you have to go to a hospital setting, basically have an infusion 3 days.
Probably need a
60
specialist.
hours, 2.5 days. Why didn't you look into it or recommend that you do that?
Well, I did look into it.
So what happened?
She ended up actually going to a partial hospitalization program at the hospital that does it. I don't believe the program was completed, but she went, and I advised her to discuss it with them because they have access to that medicine. I don't have access to it.
Is this Women and Infants Hospital in Rhode Island?
Yes.
So when you look at the medical records for Women and Infants Hospital, did they make reference to your inquiry for Zulresso?
I never received records from women and infants.
Did you ever look at them or even online?
Online?
Yeah, like online, like you do when you talk to patients.
No, I never had access to them.
Why?
Like, it's similar to South Shore. It's a completely separate hospital that I don't have access to. I don't work there.
Of course you don't work there, but you're a doctor and you're treating a patient who's got medical records that you could access through a HIPAA release, right?
Yes.
Why didn't you do that?
She was
Well, she didn't ultimately end up having any treatment there, so it didn't seem necessary.
She didn't end up having any treatment there, so it didn't seem necessary. You can't just walk into that place and say, hey, I'd like some Zulresso, can you?
I don't exactly know how it works.
He's so mad at her.
And then again, on that date, which would be October 20, you do look at the records. You checked off the boxes again on objective findings, mental status exam, appearance, speech, things of that nature.
Yes.
Excuse me for 1 minute. So when she was telling you on that date that she was paranoid, quote, paranoid about getting suicidal thoughts and something bad happened, doesn't want to be alone. What did she mean by that?
Well, those were a lot of her words.
Right, isn't that a concern? If the patient is telling you she doesn't want to be alone, why didn't she want to be alone?
because she was very anxious and had the feeling like something bad might happen.
Okay. Did her mother ultimately and then come to stay with them?
Yes,
How long did they stay with them?
I don't know.
Jim, when you talked to the mother and the father, did you say to them, what is she doing? How does she appear? Is she in bed all day? What did they tell you?
They never called my office, so I never spoke with them.
They never called your office?
They never called me or sent a message, so I did not have communication with them.
Well, that's their fault. They didn't call you to talk to you.
Sustained. Next question.
So, do you think maybe it would be reasonable if you're the doctor and you're investigating the patient's symptomology that you might, when you know that the parents are staying with it, that you would make a phone call yourself?
It's not typical when you have an adult who is able to advocate for themselves to
Right.
speak with their parents.
So while she is telling you
Right.
about
This
her
is so
symptomology
weird.
and tearfulness and crying and unable to get up and anxiety and medications and mental illness.
I'd like to cross-examine him. As a lawyer, do you typically talk to your adult clients,
Okay, on the television.
their parents?
Yes,
The next time you saw her was on October 26th, is that correct? You can pull up your record.
yes,
Now, and if you look again at the interval history where you put down what's going on in the patient's life at that time, this is when she indicated that she's back to where she felt that she was before Zoloft, which was not great, and that you guys were considering a new medication. Is that right?
yes,
And then you started her on Ativan, you talked about, right?
yes.
And then you started her on the Buspar, right?
Well, she had already been started on that again, and then we added the Buspar.
So my question was, you started her on Buspar, right?
Yes,
Okay.
That wasn't your
And also
question.
you added hydroxyzine as needed, right?
yes,
And you continued the Ativan, correct?
yes,
Did you discuss side effects with her at that point?
yes,
Did you also discuss starting Remeron or Pregabalin? Pregabalin.
yes.
What did you tell her about Remeron and Pregabalin?
I don't think I went into any detail about those medicines, just that those might be things to consider in the future.
And then you saw her on October 31st, right?
That was her, I think that was just a therapy appointment with a different provider.
Would that be Jennifer McAllister?
Yes.
So it's a different provider in the sense that she works at Aston, right?
Oh, yes, it just wasn't myself.
Right. So on October 31st, they did a suicide assessment, or she did, right, McAllister?
I wasn't there.
Well, I know you weren't there, these are medical records that have been introduced into evidence that the jury's going to have a jury room.
So,
Objection, is that a question?
Oh, good. Next question.
McAllister did a suicide assessment apparently, right?
ask McAllister.
I'm sure she assessed for suicide. Where do you see it? Sorry.
Where it says suicide assessment. There's only 4 pages for October 31st.
Yeah.
Well, actually, it would be 8 because it's suicides.
So that is the assessment that you go through. If somebody reports any thoughts of suicide, then you ask those questions, which go into a lot more detail about them.
So here you have a patient who's already reported to you as a psychiatrist that she's got suicidal ideation, worried about suicide, worried about killing herself days before October 31st. And a suicide assessment was done by McAllister, right?
I wasn't there. You would have to ask her.
Well, maybe I will.
Okay.
Okay,
Why don't we talk about
Maybe I
the
will. maybe I will. Okay.
Did they do a suicide assessment? Check off little boxes.
I'm looking for that section.
You can tell she's a therapist.
It
She doesn't
says
get rattled real easy.
that patient denies suicidal or homicidal ideation at this time.
Okay, so again, this is on October 31st, right?
Yes,
The patient, within a period of a couple of days and meetings with you, that McAllister has access to because the records are within your business, right?
it's not my business, but yes.
Has reported suicidal ideation and fear and dwelling about killing herself and afraid of those thoughts, right?
No,
She,
she said
I just want to be absolutely clear.
yeah, he's misrepresenting the facts.
So yes, you know, a little while earlier, she had voiced those concerns.
Right.
Not
So,
exactly
as a
those
result of
concerns.
voicing those concerns, is it your understanding that McAllister did not do any of the suicide assessment questions because Lindsay reported that she wasn't suicidal?
Right. It appears that she asked about suicidality.
I'm asking you about the suicide.
She don't
Hold
know.
on.
Objection.
Ask the next question. Go ahead.
I'm not asking you, you told us 3 times that she said she was not suicidal.
Objection, badgering the witness.
I'm asking you about the suicide assessment for the 3rd time. You see it?
Don't know, it wasn't there.
Yes.
Okay. Can you tell me, did Lindsay answer any of the questions that were asked over the 2 pages, possibly 3, of the suicide assessment? Yeah, 3, done by McAllister.
I don't see anything written here.
So was there a suicide assessment?
I don't know, it wasn't
I
there.
don't know because I wasn't there. I don't know what the conversation was.
Correct, right?
From looking at the records, I don't see evidence of additional suicidal questions beyond asking if it was there or not.
Suicidal assessment. It's in the medical records, and so it's almost 4 pages.
Ask and answered.
Yes.
She don't know.
And all of the questions, like.
Oh my God.
Well, life is not worth living, is that something you thought about recently, and dwelling on that, what leads up to the thoughts, what are the thoughts, all those questions, right? For 4 pages, right?
Yes.
And there is not one notation indicating that that test
So?
was ever administered to her on October.
I don't know.
31st, right?
Correct. But it looks like it was asked in other ways.
November 2nd. It was asked in other ways. Is that what the little checkbox where it says deny suicidal ideation?
Can I read something that she wrote in the note?
Indicated repeatedly that she denied suicidal ideation, right?
Yes.
The suicidal assessment was not administered according to the record that's in front of you by McAllister, yes?
I don't know.
The additional suicidal assessment, yes.
November 2nd. By the way, as a psychiatrist, not a psychologist, you have the ability to prescribe medication, obviously, right?
Right?
Yes.
And I think we talked about the DEA number and all of that, correct, which you had for about a month, other than.
Oh my God, he's such a dick.
Yes.
So you're prescribing these SSRIs and antipsychotics, and antitropics, whatever they are, and it's important as to the metabolism of your patient with those drugs, isn't it?
Can be.
Yes.
You should have said can be.
What is metabolism?
How fast
The
the body breaks it
body
down.
breaking down the medication.
So how is it that you can determine how the body of your patient is breaking down?
That's why he started on a low dose.
That is in their brain, and they're complaining about all of these symptoms. How, as a doctor, do you determine how the body's breaking down?
We don't typically have any specific testing that we do to understand that.
How about a blood test?
not done for that.
It's not done for that, meaning blood test is not done to determine the metabolism.
Not typically.
Of the patient, of the medication.
Are you referring to genetic testing?
No, I'm asking about the metabolism.
Okay.
I'm talking about genetics, I'm talking about the metabolism of the SSRIs in her body.
Okay.
You can tell that metabolism rate through blood testing, right?
Not in the way that you're describing.
Okay, what way would it be?
There is genetic testing that can give information about metabolism.
Like what?
It can talk about different enzymes that a person might have to suggest it provides
Just saying it typically.
information about the enzymes that a person might have the genes for.
Okay, so it provides the enzymes that a person might have, have a difficulty with that. What does that mean?
It's a little complicated.
That's the patient that's going through what she was going through, to understand that, didn't
No,
you? Did you guys do the enzyme test?
You don't normally do
they
it.
are not
Most insurance don't pay
typically
for
done.
it.
Why?
Because, again, it's genetics and
Good. You finish that answer and I'll allow a follow-up. Go ahead, Doctor.
so it's not as simple as testing for an enzyme or not. You can test someone's genome, like we have the ability to test the entire human genome now, but which is great, but the clinical, use of that is not there yet. So while we can test these things, it does not yield meaningful clinical information. So it's not commonly done.
And most insurance don't cover it or cover a lot of it.
What is the Cytopro P4-50 system?
That's one of the enzymes that I'm talking about.
So the Cytopro P450 system talks about and tests the breakdown of psychiatric meds in the blood, right?
It's not in the way that you're describing. It doesn't tell you what medicines to
Hold on,
take.
again, one at a time. Finish the answer and then you can ask follow-up. Go ahead, Doctor.
It just, yes, this is a test that is done, but it doesn't tell you what medications a patient will do better on. It's not useful in that way.
So what's it useful for?
I mean, I don't find it terribly useful.
How long has the Cytopro P450 system been in use in your field?
I'm sorry?
How long has the Cytopro P450 system been in use in your field, psychiatry?
Well, it's an enzyme in the body.
Well, I know what it is. I'm asking you about the system, the testing. How long have they been using that?
The genetic testing, maybe a few years. It's very new,
Very. Does insurance cover it?
sometimes.
Sometimes. So.
Depending on
it is
your
more or
insurance.
less a legitimate
And most of the time, only half.
to determine the breakdown of psychiatric.
He's so stupid.
patients' blood, correct?
It exists, yes.
It exists. Well, it exists, but you didn't use it, right?
It would not have made a difference
In what? In your opinion?
in her treatment.
Because you go by the checks and the checkbox and what she self.
Oh my God.
No, not just the checks in the checkbox.
In any event, tell me about the thyroid.
In any
The
event.
thyroid,
Thyroid.
it's an organ in the human body that regulates hormones.
And what, if any, import and impact do thyroid levels have on your evaluation of a woman who is in the throes of postpartum depression?
Depends.
They don't.
What is the purpose of a test to determine the thyroid?
TSH.
Well, you can test something like the TSH.
Well, I don't know what a TSH is, I'm sorry. What is
Because you're not a
TSH?
woman, jackass.
Thyroid stimulating hormone.
Okay, thank you.
That's something that can be tested, typically by maybe a PCP, primary care, or endocrinologist if they have concerns about someone's thyroid function.
Were you aware of a study that was a major study that was peer reviewed? What does peer reviewed mean in your business?
That it was reviewed by other researchers in a similar field.
And the report or the article or whatever it may be has to be approved by the peers that are reviewing it before it can be published, right?
Yes.
And you'd agree with
You
me that
found
in
the
the
mic.
medical field, it's a big deal to have publishing articles on your resume, right?
No, not always.
Yes.
I mean, it
And,
can, but it's
how many
not
articles have you
always.
published about postpartum? Depression, postpartum psychosis, anything?
I have published something, but it's not a full article. It's just a small thing.
Okay. Are you aware of the
Was that a gotcha moment?
Psychiatry magazine article dealing with, in 2021, thyroid function in postpartum psychosis and exploratory study? Have you ever heard of anything about that, let alone read an article about it?
No.
Are you aware that there are studies that have compared thyroid function between psychosis with postpartum onset, PPO, psychosis without postpartum onset, PWPO, and normal postpartum? You aware of that?
No.
You're supposed to be an expert, or you specialize, or you have an interest in
Why?
treating women that have suffered from postpartum, correct?
Yes.
Have you written any articles at all about postpartum? Depression, anxiety, psychosis?
No, I'm not a researcher. I'm a clinician.
Have you read any of the articles, such as thyroid function in postpartum psychosis?
I've read many articles. There are thousands. I have not read that specific article.
Thousands? Thousands of articles on postpartum psychosis and the thyroid?
No, not on that specific topic.
So, when the Astor doctors are treating a person like Lindsay, it's your testimony to this jury that testing, whether it's blood testing or whether it's the cytopro before testing, is not necessary because Jennifer Tufts doesn't think it's necessary, right?
It does not yield information that would influence treatment.
Really? So if there was elevation in the thyroid, that wouldn't impact on your treatment at all, your evaluation, your investigation?
Sorry, I thought you had mentioned the cytochrome issue. Are we talking about that one, or are we talking about the thyroid? Okay.
So
Can you repeat?
tests that reveal elevation in the thyroid level, is your testimony that you wouldn't care?
If I somehow found out that a patient had elevated thyroid levels, I would advise them to talk to
An
their
endocrinologist.
primary care or maybe get an endocrinologist to discuss it.
Right.
You ever recommended Lindsay get an endocrinologist?
Why?
No, she did not.
The answer is no. And you basically did not have any information that you could use to even.
Why is it her job?
With this woman that was postpartum, right?
If she was seeing a PCP or an OBGYN, they would be checking her thyroid levels anyway, her
There was no
TSH.
clinical reason to obtain a blood test.
All right, so you continue on with your meetings by the computer, correct?
Through the
Yes.
TV.
With a second. You can get with a second.
This guy's wild.
You get it?
She just had a baby. The baby was what?
November 22nd?
7 months old? I mean, it was 8 months old when she killed it. So
Yeah, it looks like
November,
November 2nd.
so was 6 months old at this time. She would have still been seeing an OBGYN. They would have been checking her TSH at
Yes.
this point.
And you're
Fuck.
still diagnosed with generalized anxiety disorder, GAD, right?
Yes.
You had in there adjustment disorder with depressed mood, I guess, because of what she had been telling you, right?
Yes.
Okay, looking at the psychiatric condition, you wrote that it's improving. Right?
Yes.
And then you determined that you will increase the Ativan to 0.75 milligrams for 2 weeks, and then decrease it to 0.5 milligrams for 2 weeks, and consider alternatives for sleep and anxiety. Is that correct?
Yes.
And then you know, if she's having urges to harm herself or others, to go to the nearest emergency room and call 911 and things of that nature.
Yeah.
Correct?
Yes.
So is that a form that you would basically press a button and, because it seems to be kind of like a generic advice, call 911 if you have.
Generic device.
Well, that's advice that we provide for every single patient.
Yeah, they are going to therapy.
And then you know that half of the encounter was on counseling or coordination of care. On November 2nd, right?
Yes, that's a typical statement. It's just a part of documentation that doctors use.
All doctors.
Now, on November 2nd, you were suggesting.
Doesn't matter what doctor you're going to. It all says it.
Would be Thyroid, Ativan, and Hydroxyzine, right?
Those were just things we were considering. I wasn't starting all of those medicines.
On November 22nd, now that would be almost 3 weeks later, right? You saw her, right?
She was giving her options. I don't understand why they don't see this, that it's options.
And did you ask her about whether or not she was still having suicidal thoughts or worrying about suicidal thoughts, for example? Did you ask her that?
Yes.
And how do you know that? Because the box is checked.
Oh my
It's written in
God.
my note.
What does it say?
Patient denies SI.
What did you ask her about that?
I don't remember the exact words, but I know that I asked about that.
Did you ask her about how things were going at home with the mother and father staying there?
That I don't remember. I didn't document how her parents were doing.
Well, I don't really care about how parents are doing, asking about whether or not you asked her how it was working out while the parents were there helping out. If you did fine, if you didn't, that's fine.
I don't think that I did. In this appointment,
December 1st is the next appointment, correct? And you can look at the full history.
yes,
Now, on that December 1st appointment, this is after she had transferred to South Shore.
yes,
She disclosed to you that she had been seeing South Shore, right?
yes,
We already talked about the fact that you never met the records of South Shore, so you don't know, other than what Lindsay reported to you, what medications she was on, right?
right. I knew what she was telling me.
Right, and she told you that she was doing the Ativan taper, right?
Okay.
Well, she said she had tried doing that, but that then she was having worse sleep.
Having difficulty sleeping, is what you indicated to you, right?
Yes.
And she tried other meds you had suggested, but stated that she was having difficulty with those meds, including trazodone, right?
Well, the trazodone she didn't have a problem with. It just didn't seem like it was particularly helpful.
Did you prescribe the trazodone or somebody else?
This was somebody else.
So you know what the milligrams were that she was on?
It says she tried between 50 and 150 milligrams.
Now, did she at some point try Remeron?
She said that she did.
Did you suggest in your discussions that she try Remeron?
No, I did not.
Did she indicate to you that she had rebound anxiety and intrusive thoughts, that she was going to die? Do you recall that?
Well, she said worse depression and intrusive thoughts.
Okay. Did she tell you what the intrusive thoughts were?
It was the feeling like I'm going to die. what she said.
And she said that she couldn't sleep and had worse sleep, so that had to stop, right?
Yes,
Then she tried, she was on Convenes, right?
yes.
And what is Convenes?
It's a benzodiazepine.
And on December 1st is when she told you, again, she was close to having suicidal ideation.
Close. I'm close to having it. How?
Yes,
Now, on the interval history, on that day, you indicated that she can't sleep, she's panicking, she had worse depression, intrusive thoughts, she was numb, nothing mattered, I feel like I'm gonna die. Denies suicidal ideation, but quote, yesterday, close to it, feeling hopeless. Did you give her therapy and validations after she told you that?
Probably.
I believe that I did.
What did you do? You got a woman that's telling you that she's hopeless. She doesn't care if she dies. Can't sleep. What did you do to validate the therapy?
Well, I told her that this was something that we could address, that there was hope, that there were treatments, and there are different types of treatment programs that are more supportive, like partial hospitalization programs. So she knew that she still had options and a reason to hope.
Did you ever suggest to her that maybe I can see me rather than talk on the computer?
Talking with her over the video did not seem like an issue. It didn't seem like there was anything that I was missing or that there was any need to see her in person.
Yeah.
Now, you agree with me that December 20th.
What seeing her in person versus on video would change?
Right?
It wasn't completely all done.
You still nervous about the other people and wearing masks and stuff, or you can just sit down and talk to somebody face to face?
We were definitely feeling more comfortable about being face to face with people, but I think, it was still something that we thought about.
You discussed trying Cerebral with her at that point, right?
I didn't really discuss it. She had told me that was something that she had discussed with her other provider.
So looking at your notes, does it say also discussed trying Seroquel alone tonight? Your notes say that?
It says yes, but I wasn't making a recommendation about the Seroquel. It was just a medicine I was providing her more information on.
So you were telling her about the Seroquel? You're providing information?
Yes, we were talking about the Seroquel
Right. Why?
because her other provider had recommended that she started it.
What is Seroquel?
It's an antipsychotic.
You also discussed with her the possibility of undiagnosed bipolar disorder, did you not?
It was discussed.
And undiagnosed bipolar disorder was, in your opinion, as a result of, not a reaction, but extreme reaction to the SSRIs, right?
Not as a result of the SSRIs, but that
Does your note say, and I quote,
Jesus.
also discussed possibility of undiagnosed bipolar disorder given extreme reaction to SSRIs and insomnia, period. Does it say that?
Yes.
Those are your notes, right?
Yes, the way you were saying it made it sound a little bit different before, but that's exactly what I wrote.
I read it directly from your note, right? How did that make it sound different?
I don't know, it sounded different the first time you said it than the second.
So did she have bipolar?
No.
Did you make that decision that night? That day?
I assessed that with her pretty much every time that I saw her, and she never had mania.
What about mood stabilizer like Lamictal? Did you discuss that with her?
Yes,
What is Lamictal?
it's an anticonvulsant, but it's used in treating mood disorders.
So what was the end result of your meeting with her on December 1st? What did you guys do?
This guy.
Recommendations, right?
Yeah, well, so at this time, I was not prescribing her medications, but I was still concerned, not concerned enough that she was at imminent risk of hurting herself or anybody else, given what she said. But we had a plan for her to pursue a partial hospitalization program. Well, the one that I had recommended was HRI. It's a hospital in Brookline.
And did she ultimately go to another hospital?
She ultimately went to the Women and Infants Hospital for one day.
And those are the records that you get, right?
Correct.
And you decided that she did not have bipolar disorder because in your opinion she did not meet, and I quote, the criteria. That would be the criteria in the DSM.
Yes.
And the DSM was the diagnostic statistical manual, Roman numeral 5R, text revision, right?
Yes.
Is that what you were using back then? Would be this thing here, DSM-5 TR? This is the DSM, right? It's like a cookbook, right?
It's more of a guideline that we use to to help us in our treatment, but it's not the psychiatry Bible that people sometimes think that it is.
Hypomanic bipolar disorder. How many days does that require under the DSM?
A hypomanic episode lasts for at least 4 days.
Is that per the DSM?
Yes.
Remember on Friday you said that the most important criteria is 7 days with continued high energy levels?
Yes.
So is it 7 days or is it 4 days? And who says?
Well, mania is 7 days. Hypomania is 4.
Says again, something that has to be electric, right?
Yes.
This guy needs a fucking mic on his lapel.
Indicated that she really struggled. So that recommended that.
Yes.
You agree that she had, in your opinion, a severe mental disturbance at that point that was manifesting itself?
She had a maybe moderate heading towards severe.
Moderate heading towards severe mental issue, okay? You'd agree with me that she had increased anxiety, right?
Yes.
She had very, very increased depression, right?
Well, she did. She said
Okay, so is your
since
answer
the
yes?
Ramadan.
Just answer yes or no.
I'm sorry, I was just trying to check the record.
Okay, you can check the record all you want, but if I ask you a question respectfully, can you just not go on and ramble? Answer yes or no, that's all.
It's sometimes impossible to do that.
Oh,
There's
Listen, here, if you can't answer yes or no, just say you can't answer yes or no. If you can answer yes or no, answer a yes or no. That's how we do it, all right?
okay.
Thank you. Now, mental issues like anxiety that was diagnosed, the depression that was diagnosed, and the fact that she indicated yet again that she was close to suicidal ideation, quote, worried about suicidal thoughts, but you indicated that she wasn't suffering from suicidal ideation on that day. Is that fair?
She denied it.
But she told you that she was worried about suicidal ideation and having suicidal thoughts, right?
Well, this was the time she said she was worried that she was close to having suicidal thoughts.
So did you ask her, what does that mean? Does that mean that she's standing at the edge of the stairs and she's thinking about falling down the stairs or what? What does that mean? I'm close to suicidal ideation.
So I asked about that, and that's when she said she described it further as using the word hopeless.
So did you prescribe the lamotrigine on that occasion or no?
No.
On December 16th, that's the next point she got, right?
Yes.
That'd be 2 weeks later. Right?
Yes.
She was still not well, correct? She told us she was having a really rough time.
She was sleeping, but she was still feeling very poorly.
And your notes say that she was having a really rough time.
Yes.
So when I asked you, your notes reflected that she said she was having a really rough time. Why do you feel compelled to say she was sleeping?
Overruled.
It's an important detail.
Yeah, yes. How about the rough time? What were the symptoms of having a really rough time for this kid?
Do you want me to?
Yeah, I'd like you to answer that.
So finally works, referring to the Valium and quetiapine, but very depressed during the day, no motivation, some SI. Do you want me to continue? Went to MGH emergency room for SI, declined inpatient, feeling hopeless, no intent or plan, and feels like depression related to Seroquel.
Okay. That's the question on Friday. So what was the SI, suicidal ideation?
Yes.
And can you read that back to you? What she said about suicide?
So that when she went to the hospital, she went because she had no motivation, some SI.
Some SI, mean that she had some suicidal ideation, right?
Yes, in her words, yes.
Yeah, in her words. As opposed to thinking about having suicidal ideation or worrying about suicidal ideation. She actually indicated that she had suicidal ideation.
I can't answer that as a yes or no.
Well, it's in your notes that she said that, right? Yes.
What is in my note?
You understand my question?
I'm a little bit confused right now. Can you repeat what your question is?
We spent some time talking about thinking about suicidal ideation, worrying about suicidal ideation. Saying she had suicidal ideation, right?
She said it, yes.
Well, this is no source of information that you're getting, apparently, is what she's telling you, right?
Yes.
So what suicidal ideation did she have? Was she thinking of cutting her throat? Was she thinking of throwing herself off the building, or running up under the cab?
No.
What was she thinking?
So I asked her those important follow-up questions, and that's, so what do you mean when you say I'm feeling suicidal? And that's when she said, it means I'm feeling hopeless. And then I asked, do you have intention of hurting yourself? Do you have a plan for hurting yourself? And she denied those.
And that's where you left it?
I'm sure more was said, but that's the most important part of that clinical encounter.
And did you give a therapy by the computer on that day too?
Yes.
What did you do with therapy by the suicidal ideation since you went up close?
Well, we explored what that meant, and what to do if you're feeling that way.
To do what? Call 911?
To go to the emergency room.
Did you discuss prescribing Seroquel to her? Was she getting Seroquel? Discussion.
We talked about it. I was not prescribing it for her.
What is Seroquel?
That's an antipsychotic.
Why does he keep asking the same damn thing?
So, at the conclusion of your meeting on December 16th, basically what you took away is that she had now increased in suicidal ideation, feeling hopeless, all the rest of the things that we talked about.
All the rest of
And
them.
then she what, just moved on and on?
Well, she was assessed in the emergency room and was not admitted.
Which means
And
she wasn't
I assessed her
suicidal.
on that day again. And while she was certainly struggling, she did not require hospitalization at that moment. So she was planning on going to the Women Infants program, and I supported that.
Did you know that around that time, she confessed to her husband that she was having now thoughts of harming children?
No.
Would that have been something you were concerned about?
Yeah,
If I heard that, I would have been very concerned.
right.
I might have.
And when you spoke to Pat, did you ever ask him what his observations were of her spiraling into November and December? I've got one time that stuck his face on the computer and talked to you. Did you ever talk to him?
Stuck his face on.
He never called me again, or he never called at all. I never spoke with him again.
So he is a husband of a woman, just had a baby, he's postpartum, all of these symptoms that we talked about, all of the drugs you were prescribing, she was ill, trying to get help. You never talked to her husband about what he observed. Because he didn't call him,
Well, we did speak on that visit,
which was,
the 16th. Or I think that that's the one that he was at. It's not noted, but I remember some of what we talked about. And so in reading that record, it seems like that's the likely one that he was at.
And why didn't he call? Why didn't he call the police? Why didn't he do? Why is it her fault?
You note that her mood was depressed, right?
Yes.
What does that mean? She was saying depressed or did she give you symptoms? I mean, you check the little box.
Yeah. Yeah, it means she's saying that she's depressed.
Okay, so you're the doctor, you check the little box. What did your patient tell you about her symptoms that she was depressed on that day? Was she crying? Was she able to get out of bed? Was she worshiping the force of God? What was going on in her life?
She had someone like you yelling at her?
She said she was having a really tough time.
Just kidding.
Her affect was flat, right?
It was unlike yours.
And again, depressed, you check it out twice. One on the mood and one on the affect, right?
Yes.
And then the next page, it says recent lab work. That was what it, asked her, was asked her to do blood testing.
We don't have a phlebotomist or a lab, no.
Well, why does it say recent lab will take it to form when you check out the boxes?
And that's something that auto-populates. It's a template that, many different, it's a template. The whole node is something that psychiatrists at, probably all across the country use.
Probably. You can't diagnose someone's illness by a template.
No,
What?
You filled in, no lab results were found, right?
there were none in the computer. Yes, I didn't type that in though. It auto-populated. It was auto-populated.
So on the next page, where it talks about symptom goals, treatment goals, I'm sorry, symptom reduction and improved function. What does that mean?
Symptom reduction is to have fewer mental health symptoms, and improved functioning means improved day-to-day life functioning, things that she's doing in her daily life.
Really? Did you cover all that?
Yes.
The young woman that's obviously mentally ill, pretty sick. She's deteriorating, whether you like that word or it's automatic import. What on that date did you do?
These buzzwords. She's gonna use all of them.
Tell on the computer.
I told her to go to the partial hospitalization program, and if she was having more suicidal thoughts again, or felt like she was at risk of hurting herself or anybody else, that she should go immediately to the emergency room.
Right. So why didn't you?
Probably about 30 minutes.
Was that the therapy that you provided, telling her to go to the emergency room?
Yes.
I mean, that was probably a component.
So,
What else is she gonna do? She's a grown adult.
she's 16, was followed up with willing infants, right?
Yes,
Did she?
yes.
You know when?
I don't know exactly the day, shortly after.
Then you were considering a brexanolone infusion, right?
That's the Zolresso.
That's the same thing with that.
Yeah,
And that didn't go in, right?
no,
So statin, 25 milligrams daily, right?
yes.
Continuous cerebral, right? What was the milligram for the cerebral hospital?
Well, she had told me it was 200. I did not write that prescription, so that's what her provider had prescribed her.
Okay, so you can ask somebody to show the bottle. You can ask somebody to show the CVS, you can ask somebody you can call, verify, right?
Why? Why wouldn't she told her what it
I
was?
could.
But anyway, she said she was on cerebral 200 milligrams, right? And had stopped with the Valium, right?
Yes,
And then you go on with that form thing saying if you have urges to hide yourself with others, you're gonna call 911, crisis hotline, and everything else, right? That's what that's doing.
yes.
Was the mother and father still staying with her, was it, you know, that, the kids?
I'm not sure.
Did you ever ask anybody other than her how she was doing?
I asked her husband when he was at the appointment.
Yeah, that's the other point. How about now, into the month of December, did you ever ask anyone?
Can you imagine this? Think
Well,
about
I
it.
think he was at that visit.
You think he was at this? How did he tell her? What did he say to you about how she was doing?
He said she wasn't doing well.
Hearsay.
Objection.
Overruled.
Go ahead.
He said she wasn't doing well.
Anything else?
Yeah, he felt that it might have been, his opinion was that it was related to when she started the Seroquel.
He basically said you guys are trying to get this was
Objection.
Yeah, facts not in evidence.
Overruled.
I don't have that written. He may have said that.
Is that kind of thing, though? You might remember that. You might have been.
How are you putting this in the record?
You might be thinking.
When did he say that?
He did say it. Trying to get to his
It's very possible.
Next meeting, after the December 16th, was it?
Yes.
December 16th? Is that what we decided?
Yes.
Okay. The next meeting was January 6th.
So can you
Yes.
imagine this? You're going to a therapist. Your therapist is supposed to make you feel comfortable, and they go around asking all your family members and your husband, asking you for receipts, wanting to see all your pills, all this stuff, making you feel like you're a liar and all that stuff. So that's basically what he's asking this therapist.
So at the end of an appointment, I typically will schedule their next appointment.
So just schedule January 6th.
I think that one she scheduled herself.
That was the day after she got out of the plane, right?
Yeah, usually the hospital coordinates the discharge appointment.
Well, I tell you that, in fact, the hospital told her to set up an appointment, and within an hour, she set up the appointment.
Okay, good.
That, in your notes?
Then she was coherent.
It's not in my notes, no.
Do you you remember that? It was a pretty big deal that she was in McLean, locked wards for 4.5 days, right?
Yes.
And she's your patient, and she's really gone downhill bad, right?
Yeah, she wasn't doing well.
And she admitted herself to the locked wards at McLean, right?
Yes.
What was the diagnosis at McLean?
I believe they diagnosed her with major depression.
Did they recommend any medication?
They took her off of the Seroquel.
They took her
Off of it.
off. So did you look at the McLean records?
Yes, definitely.
And those were reported easily because you're part of the same department?
No, but after someone is hospitalized, the hospital usually faxes it to their doctor.
All right, so if I tell you that McLean records really pretty voluminous, that's not what they fax. They fax you like a 2-page discharge, right?
Yes.
You didn't get that by fax, right?
No.
So what did McLean tell you? Look in your notes.
Jeez. Look in your notes.
Which part do you want me to read?
Did you ever have her sign a release from McLean? Did you ever get access to the McLean records?
I had access to the discharge summary.
So put the discharge summary aside, because that's what it does, a couple of pages. What about the records?
No, but that's typically not done.
The answer is no. You never got the records, right?
A discharge summary is a record.
Did you talk to the doctor that discharged?
No, no one called me.
No what?
No, no one called me. I wasn't notified of the hospitalization until she was discharged.
So you just sit there behind your computer and wait for people, Patrick, wait for the doctor from McLean, wait for the sick person who's the patient to call you, and if these people don't call you, it doesn't exist.
No, not exactly. I had no way of knowing she was even at McLean.
Well, you did when she got discharged, right?
Yeah, but that was after the fact.
Right. So did you care why she was in McLean?
Of course,
And why was she in McLean?
because she was depressed.
And what was does the record indicate that she was discharged yesterday? On that particular discharge?
Yes.
And discharged from where?
Well, I said MGH.
Is that National Hospital?
Yes.
And she was currently on trazodone.
Yes.
She indicated that the goal was to come out of Seroquel,
Yes.
and she described herself as still being very numb.
She
Yes.
took herself out.
Right?
That's not entirely true.
I'm reading the medical records here. Sleep, taking Ativan and trazodone, slept 5 hours broken, wondering about increasing trazodone and switching to Valium. What is that?
Well, it means she was having trouble sleeping. It wasn't that she wasn't sleeping at all.
So was the trazodone increased at that point?
Yes. Yes.
How about on January 9th? Did you see her through the computer or whatever then?
Yes.
And did you prescribe medication to her on that day?
Yes.
And was that diazepam?
Yes.
14 count, 1 milligram? No, I'm sorry, 14 count, 5 milligram.
That sounds right.
Okay. Did you also, on January 12th, 3 days after January 9th meeting, prescribe additional medication to her?
I'm not sure. I don't have a record from January 12th.
Do you recall January 12th that in fact you prescribed trazodone 150 milligrams, 30 times?
Yes.
3 days later, a couple of days later, January 16th, you recall prescribing amitriptyline.
Yes.
What is amitriptyline?
It's a tricyclic antidepressant.
What does tricyclic antidepressant mean?
Well, it's an older antidepressant. It's called a tricyclic because it has 3 rings. If you look at the chemical itself, like a tricycle, but it's an older but efficacious medicine for depression and anxiety as well as insomnia.
January 16th, look at your interval history. She indicates to you that her mood was very low, no motivation.
Yes.
Now,
Yes.
able to force herself out of bed, taking care of basics, eating, concentration fine, caring for baby, bonding feels forced. Is that what you told me?
Yes.
Through the computer, right?
Yes.
Through the computer.
What did that tell you? You concerned about this woman postpartum, well within a year from the CDC at that point with these symptoms that she's telling you about?
I was concerned that she was depressed.
And in all of the times you spoke to her, you agree with me that she appeared to be honest and forthright, telling you what she felt, right?
That's what I thought she was, yes.
Do you have any reason to think that she's lying to you?
No.
Diazepam taper on January 16th, 5 milligrams last 2 nights, slept for 4 hours, and then a light sleep, maybe 2 hours, stretches. Did she express that she was still having concerns about side effects from medications?
Not at that point.
So what does ROS mean on the interval history to look at?
Review of symptoms.
And then it says patient denies SIHI, that'd be suicidal ideation, homicidal ideation, correct?
Yes.
Denies other questions or concerns, and you recommend a low dose of amitriptyline for depression, correct?
Yes.
Patient agrees with the treatment, and we're also going to explore ketamine treatment. Escalation.
Yes.
Now, did you know that she was on her computer looking up medication after medication after medication, treatments, ketamine treatments, all of it? Did you know that?
No.
Did you ever ask her whether or not she was looking up the symptomology of pharmacology?
Which begs the question
Interactions between drugs?
that she knew
No.
all the side effects, all the symptoms, all the.
January 23rd. You had that meeting, correct? With her?
Yes.
And this is after, obviously, excuse me, the January 16th appointment. And in the January 16th appointment, she told you that her mood was very low, and that's the worst that she ever reported her mood to you. Is that right?
On the 16th?
Yeah.
I don't know if that was the worst it was ever reported, but it was certainly bad.
You didn't recommend that she had hospital evaluation. This is the day before she killed the kids, right?
The 23rd? It was the day before.
You didn't recommend hospital evaluation.
No, there were no,
Yes,
no?
Don't ask me all the questions there.
Okay.
January 23rd, Brady testified that she said her mood was depressed. You noted that her affect was depressed and flat, right?
Yes,
She also reported that her heart was racing, right?
yes,
She had no motivation, is what she told me, right?
yes,
She told you that she had been feeling numb and no emotion for 17 days straight, is what she told you, right?
I'm not sure about 17 days straight, but that's how she was feeling.
You didn't reach out to her mother and father that one. They didn't call her, I guess, right?
No,
And Patrick didn't call her that one, right?
no,
So she's sitting in front of her computer, getting help from her doctor on January 23rd. And what did you do?
well, I thought about how I could best help her, the medicines that she'd tried and what her current symptoms were. And it made sense to slowly titrate the amitriptyline so that we could get her to a dose that reduced her depression so that she would feel better.
Increase.
Yes,
That puts you over the edge, isn't it?
I don't think so.
Members of the jury, we're going to take the afternoon recess.
break, yeah.
All right.
All right. Good.
Pushed her over the edge.
That's good.
She's seen 5 doctors, went to 2 hospitals, but yet this one medication pushed her over the edge.
Jurors, but it's the board of sports in session.
Doc, you may take off. Stand. Counsel, anything we need to discuss before the break? All right, so we'll be in recess on this matter at this time.
Over.
He's so worried about this girl and having her being out on her own for a month. Find this so hard to believe. All right, we're gonna take our lunch break like always. I already have a stream set up, ready to go to come back for lunch. So I appreciate you all being here. And I will see you at 2 o'clock.
Man, club justice system, but the deck set to fail. You speak for transparency, they call it a crime. Next day, you suspended for 6 months of your time. Pedigree, politics, trophies on the wall. Vanity awards while the ethics take a fall. They say it's for the free, but we know what it is. Power in the clubhouse, silence in the pit. Pedigree, politics, ribbons and lies. Smiles at the banquet, but the truth in disguise. You can muzzle the voice, but the truth don't quit. Dog show, kingdom built on counterfeit grit.